Dear colleagues, would like to welcome those who are offline. Would like to welcome online audience with us to hear very important information. Also, would like to state that we uh, experiencing turbulence time in the history of Ukraine. None of the history manuals know that, so none of the manuals on healthcare services. And even in the darkest times, one can see lights which is bright and who defend country. Thousands of people for their lives to defend military, volunteers, doctors, civilians. I would like to stand up in honor of these heroes who died defending us. Thank you. If our combatants fight for our freedom, we fight for the light. I would like to thank every one of you. You were and you stayed there. Uh, pillar who defends it for the doctors, for your resilience in difficult circumstances. You became the symbol of hope for your patients, represented international institutions, and fund for those who, because you're with us when the burden of war difficult to carry ourselves, this sector, to choose to support the healthcare sector. Would like to thank for the transparency and efficiency of the third year of the war. I would like to thank you for the partnership for the dress, but for us, for the organizers, it's not just a conference. This is the manifest of unity and own responsibility for the Ukrainian people, for the Ukrainian nation, for every Ukrainian citizens. The manifest for the future, for the health, for the future of Ukrainian medicine, which we developed together. I encourage you to use this platform to exchange ideas, to search for new collaboration, establish new partnership. Here in this room, we have international organizations which continue to continue assistance Ukrainian hospital would like you to meet each other. We have dozens of Ukrainian NGOs which assistance of Ukrainian hospital. Please meet everyone who is present here in this room. We have about 40 chief doctors who continue to rescue life of every Ukrainian. Today we're going to talk about the future, of the healthcare services, the development of the trust, links, unity, what which make our healthcare system recover after the disaster. We already demonstrated our resilience to the world. Now we're here to unite our hearts and our efforts, our resources, for the sake of recovery of the healthcare sector, which lots of damages with the war. We have to combat all those things because we believe in medicine together. And now we'd like to thank our great partners, our great partners, Razum, who are our partners, who share our vision, who support us for 3 years already and believe in our initiative. Evelina Kavalas, I would like to pass the microphone to you. Thank you. Thank you, Natalia, for many years of partnership, for friendship, for support. And I would like to, it's nice to see you all here, those who were with us from the first day of the war, who jointly implemented the projects. we rescued together the children with many diseases. I would like to thank the donors who are here. It was great to see familiar faces and also nice to see new faces. I really like to thank you. Do I have ask you for a favor? I really, when the work is not bureaucratic, it's a smooth process. When it's built on easy interaction, I please ask your questions openly. Be open for the meetings and interactions. I would like to ask you that you leave this room with some specific outcomes and specifically with contacts. I would like to ask you that after every panel, if you have any ideas you should implement in the lab, at least just enjoying coffee with someone, with any panelists. I'm not going to take much of your time ahead of us. We have lots of interesting dialogues and topics for discussion. Thank you for being here and see you next year. Your colleagues, now we'll have the first panel. I would like to invite our moderator, Operation Director, Razum for Ukraine, Together for Ukraine, moderator, and our guest, the first panelist, Katerina Nekrasa, uh, Daria Kuznetsova, core coordinator, subnational cluster from OCHA, Alexei Vlasov from Dnipropetrovsk, Lisica, from Akhmadit, Kiev, and Metroslivchenko from Kherson region, the head of Berislav. I would like to welcome every participant, the participants of our discussion. First of all, about timing. Plus minus 3 minutes for the initial presentation because the organizers prepared very intense agenda, and Natalia said if we go ahead of time, she would make some signs to us. Let's be careful with that. Let me put it that way. I'm not going to repeat that this time is very difficult and we should demonstrate great resilience, be creative, and very often be persistent in order to find solution for difficult questions. And my question would be of the global nature, probably national, but you are welcome to, in your responses, to deal with your cases and analyze globally. And the first one to Katerina. What are the global challenges which were successfully combated during the war over these period, less than 3 years? I would like you to mention that what you were not able to do. And this is within 3 minutes slot. Yep. Thank you for reminding about timing. But we're speaking about challenges. The year 22, we should mention the people because the services were provided by medical teams on site. And we should thank not the system, but the people who continue to work. And that's critical important to development of human capital and international partnership. International healthcare partnership is one of the tools. When on one hand we as a state can share our expertise, on the other hand assist our teams to look how it works there and come with the best practice. Probably one of the challenges is people. And not a challenge per se, but acknowledgement. Another thing that we had international partners who assisted us from the first days, and was very good coordination from the side of the Ministry of Healthcare, because the ministry was one of the few bodies who started to coordinate healthcare system from the first day, and thanks to international partners, there were some warehouses organized. The warehouses, not only territory of Ukraine, so the supply was a challenge, it stays a challenge, but thanks to the coordinated efforts with the partners, in that this is something we want to overcome. But if we speak about the supply, the investments into healthcare equipment, which comes from the government side and from the partners, and indeed there's a request on very close coordination. There is a network, there is some investment go to the healthcare institution, and it's important that what is invested by the ministry should be coordinated with international partners. We cannot tolerate duplication. There are lots of international support coming, lots of investors through different projects. And so the government does lots of procurement. We should have targeted investments, developing the capacity of the institution that should be coordinated. I'd like to thank everyone who's doing that, but strengthening the coordination from the perspective of investments and the procurement of the equipment. From the ministry side, we can see that from the beginning of the full-scale invasion, and everyone can see that the increase of the budget from the public procurement for the diagnostic equipment, the earlier we identify a specific disease, it would be easier for the country to support the patient. If we speak about the challenges, people, human capital, and it's not just a challenge, but acknowledgement to those who did that, there were coordination of the investments to the equipment, medical support. When we speak about the investment, we should also mention the infrastructure. From the beginning of the invasion, I got a hint from Natalia, just some numbers. This is important for the ministry, for the development of the capacity and the investments into the infrastructure. From the beginning of full-scale, more than 2,000 institutions were either damaged or ruined, and 17.8 USD million. And this is the quick assessment. We did it jointly with the World Bank, European Commission, and this is one of the challenges, and this is something we should work. Development of the capacity of the institute, rehabilitation, and we would like to thank the partners that the current project are synchronized with the ministry's priorities for the 25 mental health and development of the human capital. Thank you very much. I'm not going to make immediate comments to go quickly for the first round. I'll reserve that for later. Daria, what's your you're a reliable partner for Ukraine. I would like to hear your vision, the challenges, the success. Would like to welcome everyone from the health cluster. We'll also gonna have the honor to represent our structure, which coordinates of all humanitarian assistance in the healthcare sector. Yesterday, when I was getting ready for this panel discussion, I think, oh, we did this, we did that. 1, 2, 3, 4, 5, 10. No, 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 no. I should make notes because we did a lot. The main, what I'm proud of, Ukrainian healthcare system was able to stand through and still is able to operate on a very efficient level. What was possible, the ministry, the government bodies were able to, when it was difficult, where there were some gaps, quickly humanitarian partners started to close those gaps. The most important what was done, the gaps were closed on the lack of equipment and medicines. The second, organization of mobile teams, which were able to get to difficult location where the common healthcare system was not able to get to, and this continues to operate, continues to be very important, especially in the close to the contact line regions. One more important mission, which I think we as humanitarian party uh, substitution of the energy infrastructure in the hospital through the alternative energy supply. Generators supply now. We have other alternative long-lasting independent solutions. They install solar panels and electric generators. And this is important, as we saw from the year 24, that would remain important for some time, unfortunately. What's also important, what we did as a humanitarian party, we first months of full-scale invasion, psychological support. Unfortunately, this was not in the focus of our ministry before the full-scale invasion, and when there was a huge demand identified for that, big contribution was through humanitarian assistance, which later was escalated to the global level, and that was done very and the development continued because the need continued. I think humanitarian party made a great input to restore the infrastructure, and we did some refurbishment, installed temporary prefabs, and we closed the gaps which at some point the government was not able to close. The work continues, and I think that humanitarianism was critically important at some point to support the operation of the health system. Continue to thank our international partners that the network and our healthcare system was able to stand through. A great acknowledgement for those who united for that. Metro, I would like to hear the voice from the regions to understand how you manage to deal with those challenges and be efficient in rendering healthcare services. The microphone is yours.
Рассказать про наш район.
Good morning. So, what I can tell about our district, we have a big district. We have 11 communities. We've got 4 hospitals. So we've got around 90,000 of population. So we were occupied and we were deoccupied. So all clinics were looted, destroyed, ruined. And one of the clinics was totally ruined with bombs. We just got 2 hospitals, more or less, for recovery. We recovered, we reconstructed all these 2 hospitals. We did all we could, and I'm very thankful to the doctors who didn't flee from Ukraine, who helped us, who stayed with us. A big thanks to Natalia, to whom I addressed right after the occupation for assistance. So the fund gave us the clothing, the gowning for the doctors, all the equipment needed, all the things that needed for treatment. And as of today, We have around 30,000 of inhabitants. The situation is quite complex, difficult, since we stay on the Dnieper River mostly. And I would like to say it's not a war, it's just a genocide, it's total destruction, it's killing. It's just a killing of our population, since first they killed just the citizens and I mean the civilians. And when civilians say when people are killed lying or wounded lying in the streets and the ambulance comes and they try to hit the ambulance, and so they destroying roads, infrastructure. We having lots of wounded people, and big thanks. I mean, because of the shelling, big thanks to everyone who helps us. Thank you very much. Thank you. We really appreciate your resilience, that notwithstanding of such difficult conditions and your geographical quite close to the frontline location, you continue to live, to function, to provide medical services. Thank you very much. Alexei, I would like to say that the facility you are heading, it's over important, and I would like to hear from you a detailed report about what you managed to achieve during this wartime. What were the challenges? You know, we happen to be in the war in the difficult conditions here in the different states. So we, as in Dnipro, we had to receive our wounded soldiers and wounded civilians. I mean, before the war, I mean, during the aggression, but with the beginning of war, I think the challenges are the same for all the hospitals in Ukraine. Since the utmost challenge was for us it's to create the safe conditions for the medical personnel as well as for patients. And practically all the hospitals started to create the shelters. So this was the main and first challenge. I mean, to create a shelter. And the second is to create the full automation, individual functioning of the hospital. I mean, oxygen generators, all the generators, power generators, all the auxiliary supplies and water supply. I mean, to create a hospital fully independent of the central infrastructure network. And so the United 24 platform allowed us to tell about needs, identify the donors for in order to resolve the current questions, since if through donors help. And next is also not just technical and material assistance, but the training of medical assistants, of the doctors. So, and we practically built a new system of rehabilitation, starting from the blast trauma to pediatric rehab and so on. And so the big attention was given to the infectious control. We created powerful bacteriological labs that was possible through donor help. And then the evacuation, medical evacuation. That first of all, Médecins Sans Frontières, MSF, that they helped us to evacuate not only the soldiers but also the children, and further evacuation to the western Ukraine and abroad. So I think I would like to say that every year of the war, brought its own challenges that we had to overcome. Thank you very much that you kept really withstand in Dnipro Oblast since at the very beginning of the war. We even couldn't imagine what regions will be occupied, who will withstand, and your Dnipro Oblast really showed great resilience. I'm proud of you. And the most that is of interest in the audience. So whether or not Ahmadid managed to restore the full-scale functioning and the services in order to help the children who are the most vulnerable population. So, I'm a maximum positive person, but I will not pretend that my ideas are the best and the but to my mind, at first the project that we implemented allowed us to evacuate the children, the most difficult children. So we managed to evacuate the most complex patients to Dnipro already the 8th of July. And thanks to the international partners in our civil society, we managed to be flexible and really in time, since the order of the Ministry of Health was published only the 10th, and already the 8th, we already managed to evacuate the children. But we had to first to calculate the analytics of the load on the hospital, since we have to first analyze what hospitals have to be restored first, since we have to calculate the number of population at first, and really the loading on the hospitals, the loading on every doctor. Yes, we understand that we got much more hospitals right after Soviet time. Now we are limited in number of hospitals and population, and we have to make the good analytics in order to use the qualitatively and effectively all the let's say facilities we have. And when we talk about, for example, our work, we provide the immune therapy and cell therapy to those children whom we admit to our hospitals. So, and that next in August we did the relegation, and we continued the process of treatment. They were titanic efforts for the doctors in the stress for patients. I mean, the relegation. So yes, we got lack in communication, and my big upset that we got the image risks, and yes, this since it really affects the links with our international partners. I'm not responsible for the whole hospital, but yet let me express my excuses to for all the shortcomings that we say committed, since we try to shift the paradigm of treatments and to really to apply all the efforts, since to ruin the trust is the biggest risk, first of all. Now, Alexander, the question to you to talk about
те, що ви знаєте,
the
насправді
network,
сьогодні всі намагаються,
and
багато неурядових організацій.
that lots of NGOs in local governments try to help the medical network.
На превеликий жаль, допомога не потрібна і ця
Sometimes they try to restore
лікарні, які не
what is not necessary. For example, in some small um,
після того,
small
як
local
здійснюється
clinics, which are not worth to be restored, and plus it is increased load what to do with this equipment, with efforts spent, and now we have to close this hospital, and say still billions and billiards are spent to ineffective part of the network. So my question is, what aspects need really the first response, and how do you see the solution for such issues, since the demography is going to change, and this will affect not only the healthcare network, but also we have to regroup the
широкий спектр
provision
території країни, і все ж таки
of services all over the country. We have to optimize the network somehow. So, Katerina, I expect from you the specific response. When we try to think the investments being done in the healthcare facilities, say, here I think we can use the dream system, since when we think about capex and the expenditures and the assistance from international partners, I think everything should be done through this system, since lots of projects have been uploaded into the system. And for example, in case we don't have the project within the system, so we can think, really, is it worthwhile to invest in such a project? And every time when some donor got the request to invest some specific location, so usually this donor comes to MOH and asks whether or not is worth to invest in there, since it's not always in line with the vision of MOH or the local government for this region. So that is to say, we don't have to invest in everything that we see. So when we talk about the infrastructure in the capex, so it's really what has to be used for the decision is our dream system, since lots of projects again have been uploaded in there, and the synergy of investments is the direct expectation from the international side of the international partners. In those project feasibility documents are first of all needed in there, namely, here we support that the idea that the investment should be targeted, coordinated with MOH, and not just for everyone that expresses the need for. And here the MOH in this aspect also has a leading role in In there are colleagues with whom we work together. And in case, for example, what I have to say, um, if really having the good information from the meddates that will allow us
пріоритетними, це було просто
to choose the real
дуже
priority,
я переконаний,
hospitals and everyone would would applaud to this fact. And when we talk about creation of the electronic instruments,
комунікації,
uh,
напевно,
which aim is to ease communication, to ease the systematization. First of all, for these instruments, really also to be effective in use, but not just creating the digital instrument and then to say, okay, go on, use it, and we will see how it works. Okay, I agree, but when we ask whether everyone is supplying the information, uploading all deliveries and so on, not, since we are frequently addressed by the parties who are asking, oh, sorry, we forgot to upload our data to your system. Sorry, sorry. So, and then when we come to see the commissioning facility, we see lots of equipment staying not installed, just staying packed. So that's why the question is mostly to create some global inventory, since do we know all the equipment, I mean, about all the equipment which came to Ukraine? Whether all the consumables are being delivered to such equipment? No, we don't know. That's why we have to think over. In here, it could be the request on some global inventory. And then when we are talking about the requests, we are used to ask slightly more, expecting we will be provided slightly less in order to have what we need. Okay, so we have the system and can be propagated for every nomenclature, for every facility. But again, when we collect the needs through E24 system. This is not just the civil facilities, it's a military, healthcare facilities, and so on. But again, the information is present. And here we have to talk about every single request to coordinate the deliveries, to check whether or not such equipment is really delivered or shipped to such specific facility. In particular, whether this facility is ready to accept this equipment, whether they have the personnel, and then in case we see that something is not ready, say we really redeliver.
Definitely, there's a need for that because complemented that what is funded by the government, supported by the civil sector, supported by international partner, should be there because that be a synergy effect. My suggestion would be not to be limited to the system because it can be expanded. It would be replaced next year, and this is a small spoiler. But we need to think what would be there. Not every medicine, every disposable, what we be able to offer. And I think for the institution, it would be easier to operate because there is a feedback option, because the request for the business, when you send a need, whether it would come in a year, the 10 or 15 vessels would come.
Я бы сказал, которая
Let me
60
put it that
получается,
way. It's a huge challenge for the
экспертов
ministry and
для
huge
всех, кто
challenge for
кто
everyone who took the
за
responsibility
бюджет.
today for the
И
system. In
приезжают
that
миллиарды
systems for
гривен,
billion hryvnias comes
миллионов
to
долларов,
Ukraine and
скажем
million
так.
dollars,
И
and
наши доноры, где
our
нам доверили
donors
систему,
who
они
provide these assistance,
разраховывают
they think for consider
систему,
efficient allocation, efficient
кожна
distribution. They think that
невелика,
every
невеличкі
small
елементи, які вони
element,
вкладуть, чи
small
то в
bit
формі, чи
with
то
it in kind
вони
form or
вірять в те,
money, they
що воно
believe
працює.
that
І
it
коли ми
works.
часто
And when
бачимо
we
міскомунікацію,
see
вони
very often
виявляють
miscommunication and efficient use of the resources, that causes some concern. Brief comment on Seba about efficient coordination between humanitarian, so whatever comes on the authorized warehouse is digitally registered, and we may respond with support documents what we got and what was resent.
Я мрію
Final
побудувати
comment, I dream
ефективний
to visit
автоматизований
authorized digital warehouse of the Ministry of Healthcare to see how one should work. I'm looking for an invitation. It's not warehouse of warehouse. These are not our own. These are logistic partners, our partners, which are engaged by the ministry and international partners. This is exactly what I mean. Show us how you do that. It's not just a comment, it's a wish to learn more. So now we go for an open microphone. If any one of you has any comments, you're welcome. Brief comment on it's important not only to understand where it goes, but who is the recipient. We need to understand the challenge, do the analysis, and the project that would strengthen the team of the hospital to do a project design. And when they describe the problem, the challenge, like specifically how many patients, how many years it will be in operation, how the services will be provided. There is a team, and when all the criteria say, well, there might be a green light. I don't think that until there's a team and the conditions, I would not make any investments total. But for many institutions, and I'm not working for the ministry, I work for the on international partnership. When someone does a mistake, and then a partner comes to another, or you come to a partner, it's not important who made the mistake, a wolf or a fox, because he got negative experience. So that means that we have no right to make mistakes, and we should open the cards and play openly
Ще про єдину медичну систему.
when we speak about the unique system. So the city of Kiev, Ahmed is not a part of the city of Kiev because there's Oblast healthcare departments. Everybody has his own business, a package of medical guarantees. The ambulance from the left bank goes to Boyarka. So a child could be in the ambulance for 4 years. We should stop discussions. We should find solutions. The healthcare system indeed should be really a unified, focused on people, but not focused on kingdom of Kiev, city of Kiev, left bank or right bank. Any other comments? Anything? Would like to make a compliment. Yesterday we had a meeting with our team. We discussed our strategy and plans for the year 25, availability of information, how to discuss the cooperation between the cluster, information exchange to make it efficiency. This is something we're facing. Every day we get lots of requests from healthcare institutions, and sometimes we really open widely our eyes. But with all due respect, there might be a small hospital in Donetsk region which has expensive equipment. Just okay, maybe they may have a specialist who can use this expensive equipment. First, it's a problem which has not been solved yet, but technologies are developing. Maybe we'll be able to reach good consensus how to deal with the challenge. So that's when we talk about the specialized assessment, but there's initial aid. There are some mismatches when the resources are invested, but how to bring a family doctors to a remote village which may have their own doctors. We should not focus only on the second aid, second line of
ще є 15
dear
хвилин
colleagues, we have 15 more minutes. We're great on timing. Natalia should acknowledge that. We'd like to understand what are
проекти міжнародної
the
допомоги,
projects,
ви
international
знаєте,
projects
вашого
and
досвіду
donor assistance,
загалом найбільш
which are, from your
ефективними,
perspective, the
які
most
здійснили
efficient.
за ці,
We did
скажімо,
sort
понад
of
3 роки
over these less
найбільший
than
вплив,
3 years,
де
the
ви
biggest
на своїй
impact
практиці навіть
on your
відчули це,
practice. You
що це
felt
дійсно
that
діється і
it
справді
really works,
працює.
that this is what we really need.
Тобто таким чином. Я не
Oh,
може можна виділити там декілька.
just you're welcome to name several,
Я
Katerina.
думаю, що завжди з вас.
Let's start with you. Frankly speaking, I would like to because it would be an objective assessment. We don't cooperate with everyone who non-stop healthcare services or mental health would abstain from making. I can comment on the progress of the projects which we can, but I would not go for the priorities because all the assistance it's very important. We simply don't see everyone again from the perspective of the procurement. I think the ministry would not put the scores because they're different international partners support different streams. So to us, what's important, this is existential question.
Ті проекти,
Okay, those
які
projects
запускались,
which
не
you
були застосовані
remember,
просто.
which
Я теж
are
впевнений,
implemented,
що кожна гривня,
I'm sure that
яка йде
every
в Україну
greener
від
which comes to
міжнародних
Ukraine
донорів,
from
вона
international
дуже
donors is
саме
very important. We have no doubts. Let's put it that way through the lens of availability from free aid and availability for the medicines, devices. Probably may speak about one of the SafeMed USAID project. The outcome of this one, the reimbursement program, available medicines, and next year it would be expanded that the citizens and the pharmacies can get some specific medicine. With program will develop in several phases. They transfers to the regions. They did the analysis. Some tools work efficient, some not. Now it's a this is bringing the closer to the patients, availability, that that program works. On the other hand, this is about the transfer from the centralized procurement when I was a temporary case with international partners who were ready to join the process and do centralized procurement. And the outcome of the project, there was an agency established which does absolutely all the procurement using public money ordered by the ministry. So this is more about availability of medicines and medical devices. But again, this is not talking about the priority, but the projects which we can provide our comments on. Globally, I would like to thank, because we understand that the so with the support of this system. On the project side, I do a charitable superhumans project, and the projects which are focused when the medical teams comes and this is here, and in parallel, our doctors go for training, vacation, so we know where we should train our teams to do those. And this is an investment into the future, and would like to thank the partners, which team coming from the US, from other countries. This is an internal growth and the development of very strong teams on site. And that's cool. And we managed to launch a charitable project. A specific project in Ahmadid, and I would like to thank our partners for that.
Дякую, колеги. Можливо, з регіонів щось
And it comes from the
є якісь
regions.
кейси.
Many know some cases. I would like echo that the number of the population decreasing and the number of institutions remains the same. The scope of assistance is reducing, and actually, what you mentioned, and Alexander, we need to consider centralization of assistance, the level of the hospitals, which would be able to provide highly specialized assistance and coordinate humanitarian support to the hospitals. From the aid which we got, we cannot speak about one specific. There were some priorities throughout these years, some challenges, and the assistance which we got. They're right. And training of the staff, training of the nurses, development of the system of the infection control, rehabilitation in the country. Those were the best, which we, and of course the equipment, the refurbishment, which we got next to the humanitarian donor assistance. This is important as well. But in the context of investments into the knowledge, that was an interesting priority. I comment from the regions. The situation looks like there's a team, a medical team, the doctors who can do surgery or there's a team, but no hospital, no premises, meals. So there's a vision that less hospitals, there's less money. I call the colleagues who can supply some basic food. So the hospital uh, may have daytime 140 patients, at nighttime 120.
Дякуємо щиро, Дмитре,
Thank you
за
very
якісну
much for your
теж
openness.
працю, чуємо
Very often we hear
єдині
also
складні кейси, які
that there are
соціальне реагування.
difficult cases which immediate response About 7 years ago, they said that, oh, you should invite young doctors, offer them housing. So now there's a different vision whether we need to have hospital in
Ну, я ж
remote
тоді, я
area.
тоді що
There is a
16
hope that the events which we carry, the measures which we take, would be a partial response. So we have the government representatives
є
here.
останній,
We're going to talk to them.
останнє
And
досягнення.
there's a final
Принцип
question.
спілкувалися
Basically, we
українською,
plan this conference as
аналіз економіці,
development of some highlights, the development of the milestones for the year 25 for the non-government sector to
чи
understand
можна було
what we can,
цього році
how we can be
і
useful for this year, what areas we should consider, what would be the most important areas that in the year 25 we would make the network even stronger. Katarina, again, we start with you. It becomes a tradition. Ah, yeah, this is your role. If we consider several, that would be a summary of what we discussed already. One of the first ones is human capital. The colleagues already indicated school when there is an opportunity to train the teams here using the trainers who come here or sending the doctors there. So human capital development. Second, development of the capacity of the healthcare institutions. So we have a lot of the institutions, and there's still coming requests because there is a damage within the system, and we have to restore those hospitals to make sure that the services are provided. And those projects are within the DREAM system and rehabilitation and mental health. And reflects on previous comments, I realized, listening to the colleagues, we cannot speak about one international policy because if we go back to the reform, we need to thank to all the partners who believed into the reform. So different components were the results of cooperation with international partners.
Дякую. Щиро.
Thank you, Daria.
З вашого боку хотілося б почути, може,
Uh,
про ваші особисті
your
напрямки,
main
з якими ви плануєте
areas,
працювати в разі
highlights.
Коротке пояснення, що кластер працює
The
виключно з
cluster
гуманітарною
works
допомогою.
exclusively with
Це
humanitarian
забезпечення
aid,
обставин
closing
під
the
час якихось
gaps during the
кризових ситуацій.
crisis,
Тобто ми не
emergency
працюємо
cases.
з
We don't work with the
девелопментом.
development,
Але на
but
25
for
рік
the
ми
year
хотіли
25, we would
власне
like
стежинку на
to
яку
consider a
вчора
path
до
to early
це наш
recovery.
главний план.
This is our
Це так
plan.
званий Nexus. Ми
We have
намагаємося розбирати
Nexus
замість
term. We
вивчити
try
історичні
to
речі, що
learn
спрацювало, що
what
не спрацювало,
worked,
що
what
як
did
з цим
not
працювати далі.
work, how
Але
to
звичайно,
go
що наші
further.
пріоритети
So our
залишаються.
priorities
Основною
remain,
це
and I fully agree with Katerina,
реабілітація, це психічне
rehabilitation,
здоров'я, це
mental health, response to
реабілітація
emergency
буває
cases like damages,
масові
mass scale
ситуації з масовими жертвами. Також важливо
murders.
знати, що держава
Important area
залишається
for us
важливим
remains
центром медичного
development of
персоналу,
the
забезпечення
human
важливим напрямком.
potential,
І, звичайно,
and
ми
of
працюємо,
course
щоб міжнародні партнери
that the international
більше спрямовували.
So, and we would like our international partners to streamline their forces on nationalization and localization. These are the priorities. And plus, for the international organizations to become a rather technical expert, technical consultants, and for all the assistance to go through national Ukrainian organizations. Thank you, colleagues. Anyone to add something? See, me say, I think first of all we have to create the single network on healthcare facilities, plus in particular to analyze all the areas with orphan diseases, for example, but not to really well I mean to distribute all over Ukraine. It will not be advisable, and plus after the documents mainly they were developed by the president, by other national authorities, is really good. I mean these documents push the actual I would say forces I mean to pushed up the efforts to develop the Ukrainian healthcare network. Say, for example, when one calculates that, okay, we have the stuff, um, we will start our own hospital. And for example, my wife told me that I will get the third work, third job list, like for 0.35 of my daily rate. Since what? Why? I asked. So they, since they also enter the national healthcare system, what they have, they just some cardio and nothing more. Say, really, this such facts they demotivate. So the general community, since we have to assess the work by the efficiency. First of all, for me, 2025, the maximum priority is to create the mental health care system to provide the services not only to the patients but also to medical, I mean healthcare workers, and plus to be equipped with the modern equipment. And the third is to recover, to restore all our healthcare facilities, mainly in the eastern part of Ukraine, which almost ruined. For 2025, I would like to wish everyone victory and to stop hearing all these bombs and shelling. And these are my plans for 2025. We believe, we trust into our victory. Thank you very much for your work, for your efforts, and let's applaud Katerina, who was sent here from MOH in order to support the bases. Natalie, the floor is yours. Thank you. Colleagues, one more, let's applaud all the participants, to all the panelists, to everyone who came here from Kherson. So this is our first panel. We planned a short one for you to get more coffee, to socialize with each other, but I invite you now to take a family photo. So please come here. And our photographer will help you to arrange in the best way to get a good photo. Thank you. So, colleagues, please invite all your friends, partners, colleagues. Please make yourself comfort. And now we will get the most interesting format of our meeting. This is a donor marathon, and then we will have discussions.
Ми дійсно можемо змінювати системи і допомагати робити неймовірні проекти. Саме тому партнерства, партнерські проекти, співпраця, гранти є надзвичайно
Колеги, прошу сідати.
Colleagues, I invite you to take seats since we get to fit into our timing of our agenda.
хто прийшов і сподіваємось побачити з вами наступного року.
Беремо готелі кожен рік. Ми розказуємо їм як про разом.
Колеги, прошу сідати.
So, dear colleagues, please take seats, take your seats. Please respect our guests who are ready to give their reports. So please take your seats and make yourself close to the screen, since it will be better for you and also for the whole picture, since we take pictures for good memories.
Будь ласка, сідайте. Попрошу своїх колег покликати наших колег, які зараз ще продовжують насолоджуватися кавою.
So I would like to invite all our colleagues who yet are delayed with the coffee, since we will get very interesting format of 5 reports from international organizations. This will be the unique panel where we will get the presentations, and we will hear about prospects and planning and financing plans for the next year. The reports will be done also in English, so please use the headsets in order to understand the context. Those who need the headsets, please address to our organizers. So just 1 minute and you will get your headsets from our assistants. Then we will get the marathon, and then we will get very interesting debates. And I will introduce you into the debates panelists. So please invite everyone who yet delayed. So colleagues, we start our second part. We'll get the donors marathon, the very interesting format where our partners, international partners, international assistance representatives will tell you about the project to be supported for 2025. So we will discuss the fact that the crisis is actually the opportunity and how to use the crisis as an opportunity for Ukraine. And now I invite the representatives from USAID, so please, to take the floor.
Добрий день, шановні колеги. Я буду говорити.
Good morning, dear colleagues. I'll be presenting in Ukraine. My name is Paula Pavlenka. I work in the USAID healthcare department. I'm very happy to see very many familiar faces in there. First of all, my thanks, big thanks to the organizers for this meeting that is quite in time, since we all together, I mean, government representatives, MOH, PHC, and international organizations are great. All of them are great use. First of all, I would like to provide, to hand over all the greetings from our director in Robin Martz, who was invited, but unfortunately, due to some family conditions, she had to return to Michigan, but she'll get back in January here together with us. Okay, now the greetings part is over. Let me switch to the next slide. I think everyone is eager to know what will happen in 2025, but we started our own activity to cooperate with Ukraine for a long time ago, and we use our own strategy, USAID strategy for Ukraine. And so the strategy was developed all together with all the experts and consultants till 2024. But then we decided that this strategy is still relevant, considering the aggression started in 2014, and now it's really increased. Sure, it's turned into active hostilities. So, so we consider that our strategy is still relevant for these times as well. So, on this slide, you see our overall target. This is the support of Ukrainian aspirations to independence and flourishing together with European treasures. So we have within the four aims of development, but none of them tells you about the healthcare. So you maybe will ask, that you don't care about the healthcare? No. As you see, the elements framed red, this is just about the healthcare sector. So increased health system transparency, so to fight corruption, namely within the healthcare sector. And we work in this segment to get practical results. So first of all, to improve and increase system transparency. Over there are several sub-items, namely the management or governance and reporting, then e-health system, and reduction of corruption risks in pharmaceutical procurement. You heard about the SafeMed project already, which is the key one in there. As is the second strategic aim, namely mitigating impacts of Russia's aggression. So we work on improved conditions for reintegration, considering the modernization of the healthcare system, and namely in the frontline areas and the deoccupied areas. And the fourth big part to put the effort for all the mission, that is the Ukrainian economy recovery, and namely within the infection disease burden reduction. Since if we don't have healthy people, we will not be having healthy economy. Sorry. Okay. And there, as always, programs for healthcare At the very beginning, they had only one program, namely, as you see, infectious diseases. This was a traditional program, and yet from the very beginning of USAID, we established several programs like PEPFAR, TB fighting, and so on, other multi-resistant TB. But right after 2014, the program increased in amount. So we created a program to support the healthcare system reforms. And together with the COVID time, we developed COVID diseases prevention, and to build up the good response for the healthcare. And then we started to work on mental health care. Now that gets closer to the recovery or reconstruction of the healthcare sector and the services, healthcare services. I would like to express my big thanks to a person, Benziner. Mr. Benzina was a director of our program. He joined us in 2018 in COVID times, and then he stayed till the very beginning of the war. At the very beginning of the war, our office was rather small. We just got 3 Americans and 4 Ukrainians, and so we were all spread over the country. Ben was Utustan. We are in Vilnius. Half of our colleagues were in Vilnius, other half in Kiev and Lviv. And so at first we started thinking what to do. Since projects were ongoing, then we started to think what we can do more, and starting March, Ben told us, so we have to do more to support the healthcare system reform and to support the system itself. So then he connected WHO and World Bank, motivating them to provide the direct support to the Ukrainian budget, and namely the medical guarantees program, in order to provide the wages payout to all the healthcare professionals. It was hard, but he managed to do it, and he got the agreements with all the donors over there. And starting 2022, this program started, have been launched in Ukraine. So thanks to everyone who did this. Thank you. And also, a big thanks to all of you, since if not reaching the progress in reforms we started yet in 2016, to do this would be almost impossible. So everyone gathered together saying, okay, we were naive. In June 2022, we were sure that the war will end by the end of this year. So we started to think about recovery, and then again, WHUSA and the World Bank gathered together, starting to think about it.
Reproductive health under the health cluster, which actually my colleague Daria was presenting. And this platform is called Sexual Reproductive Health Technical Working Group. So let me start although I will see my presentation only, which is okay. So what is the role of, the task was given quite clear to me and precise by Pani Natalia, to share experiences and to share opinion of international partners regarding what can be their investment into restoring of healthcare system in Ukraine in 2025. So I would like to start my presentation with reminding about one platform or one deal which actually was launched in 2016 during the World Humanitarian Summit. Humanitarian workers know about this. It's called the Grand Bargain. Please wave if you know what is Grand Bargain. So I think I can present what is Grand Bargain. Grand Bargain is a deal between major donors, big donors, and oops, great. It's not. Oh, okay. Okay. Ой, it's something wrong. Ну, ничего, ладно. Okay, great. It's okay. No problem. So it's a deal. Grand Bargain is a deal between the major donors and humanitarian aid organizations that aim to get more means into the hands of people in need in order to provide effective and efficient care. And actually, my colleague Pani Paola, she showed here an ideal example of Grand Bargain when funding went directly to the health system, to the budget of health system, to support system, to provide services. And one of the main principles of Grand Bargain is a localization principle. Localization principle means that donor fundings are given to aid agencies that are geographically located close to emergency. And it's a commitment of all members of Grand Bargain that principled humanitarian action should be as local as possible and as international as necessary. So now you understand that Ukraine in very good position, I mean the position of local and national actors to gain funds. So what is here the international input? What can be input of international actors here? The people who are presenting here, international organizations, know very well. Our first principle is quality of care. So we're asking everyone who is involved in provision of health care, is the principle of localization aiming provision of health with the standards of care? So based on our previous panel, we did see that there are still a lot of gaps in provision of care in terms of quality of care. Even after 3 years of full invasion, we see that a standard list of equipment for different types of facilities is missing, or if not missing, still it is not in use. And I will not, I a bit changed my presentation. I will speak from a position of my own organization, United Nations Population Fund. Mandate of our agency is provision of sexual and reproductive health. And organization is following is focusing on 3 transformative results, which I will present No, still I cannot present. Okay, no problem. I will tell. So 3 transformative results. This is accelerating the reduction of unmet needs for family planning. You know, when I am speaking about family planning in Ukraine, people are getting like with these eyes what she's talking about in a country with demographic challenges, yes? Family planning, according to WHO definition, is not only use of contraceptives. Family planning is also infertility treatment. Okay, I will stop here just to give you a space to think about that family planning is how important family planning in Ukraine. Second focus is preventing maternal deaths, and third focus is combat with gender-based violence while ensuring equitable access to quality care. So now coming to the practice, to the example of Ukraine. What do we see? We see reform started a couple of years ago and started from the primary level care facility, which actually my colleague mentioned here. The main goal of reform was to strengthen the gatekeeping function of primary health care. It's important for efficiency of fund using. Ukraine, as my own country, where I am from Armenia, we experienced, let's say, I'm trying to find a diplomatic word, Semashko model of care, which was highly centralized. And even till now, we still have, you know, in some extent, we have influences of this Semashko model. You know, most of our discussions are running around specialized level of care, about hospitals, and less and less people are speaking about primary level of care, etc. So now let's talk about efficiency of this model. I will be very simple. For example, if a person, during the Semashko model time, if a person had a headache, yeah, he was going, for example, to neurologist. Neurologist was doing investigation and then referring maybe to cardiologist, high blood pressure. Then cardiologist was doing investigation and then referring to endocrinologist because some endocrinological disorders are there. Can you imagine the money which patient was spending on this type of model? It was 10 times more when usually in other countries, developed countries, system is spending. So when we are coming to the financing of the system through program of medical guarantees, we see that all this, if figure of family doctor is not strengthened, the system will spend a lot of unnecessary money. That's why the figure of family doctor was strengthened, and the family doctor became a gatekeeper for organization of care. And according to international standards, only 25% should be referred to higher level of care. So 75% people should be provided care at the primary level. So you can imagine the saving of funds when you have family doctor strengthened. But when we started to do our SRH programs, sexual reproductive health programs, we saw that referral system is working for all specialties but gynecology. So people still are going to the specialized level of care, to gynecologists, to have all investigations, etc. done. And you can imagine that instead of 25% applying to gynecologist, 100% is applying. It's just a simple calculation. 4 times more system is paying for a woman to receive sexual and reproductive health services. So we went back to the history, why this kind of exception happened for gynecologists for sexual reproductive health care. Turned out to be that doctors, family doctors, are hesitant. They don't want to do that. You train them, you provide programs. Most of them, especially in rural areas, they are retrained therapists, pediatricians, etc. Nobody wants to do gynecological examination of women. That's why, for this sexual reproductive health exception is done. And here, by international, I am coming up to the international support and international experience which can be provided by the partners. So international actors can facilitate international cooperation, enabling Ukraine to benefit from shared experiences and tailored solutions. So we applied to these shared experiences, sharing of experiences. We asked ourselves, okay, how does it work in other countries? Turned out to be that Ukraine has a workforce, according to register, which is not used in full. And this workforce is called midwives. And midwives at primary level of care, they exist. Turn out to be that they are, because of the services, because of the services not required by community, they go directly to gynecologist of the perinatal center, for example. These midwives, they were like re-qualified as nurses. But they still have midwifery skills. So what was the role of international organization having a mandate of SRH? We didn't start from advocacy directly. Let's invest into midwifery. No whatsoever. We have conducted a pilot project covering 12 grommadas. In these gromadas, we found completely, like without any incentives, former nurses which had the education of midwives and started to build their capacity. And their capacity was built through peer approach. It was done by Association of Midwives in Ukraine, and it was a sprinter project, just 4 months of project. We applied to some innovative technologies, use of applications, etc. And after 4 months of directly being involved, the project was handed over to Association of Midwives without any money. So Association of Midwives is working completely free of charge. They are not an organization who is receiving money, grants, etc. They are just a professional association. And can you imagine, 9 gromadas out of 12 gromadas, they have shown high sustainability, and there, after 1 year of finalizing of project, still it works. Still we have office of midwife, Alla Vitalievna, once per week, Wednesday from 9 to 12. She's receiving patients who are according to the prepared list. This office is in the eastern part of Ukraine, and there is no need for midwife to be constantly there. So one midwife can cover actually up to the 5-10 ambulatories, once per week or once per 2 weeks. She can go there, she can do this gynecological examination, she can do different cervical cancer early detection, for example, and thus population is benefiting from that. And based on this pilot project, we are starting our advocacy efforts to build midwifery in Ukraine. And you will be shared the slides, which I was not able to share, but you will see there is a slide, Yulev, you can show why we can invest in midwifery in Ukraine. Here, please, you can find that it's really approach which is currently recommended by WHO global positioning paper to all countries. If you think that midwifery is a workforce which is used in developing countries, you are mistaken. Many developed countries like Norway, Sweden, Canada, they are using midwifery-led models of SRH care and considering experience of Ukraine in failing universal health coverage for SRH. Based on primary healthcare approach, I do believe now to be that 70% of pap smear results were false positive. And at that time, there was no conization or organ-saving operations. No, they were removing everything because there was a cancer. 70% of women, they became disabled just because this simple procedure. That's why WHO is recommending constantly, please switch your focus from pap smear to HPV screening. So, and Ukraine doesn't need to go through the same, but pap smear was not even well established in Ukraine before. And now Ukraine is trying to catch it up, implementing and putting pap smear into the medical guarantees program, which actually we as international partners are warning and recommending. Don't go through old archaic methods. You can go directly to the innovative pap smear method and save a lot of money. So just concluding, because I took also too much time, I tried to bring our point of view that the support of donors and international organizations and agencies cannot be only related to funds. It is, of course, it is as per the grant bargain and localization, but also in bringing technical expertise to make use of these funds efficient. Okay, so and please, at this very note, I will end up my speech. Thank you very much for bearing with me.
Thank you, Ірма. Колеги, я дуже сильно дякую Ірмі і
Colleagues, I would like to express my big thanks to Irma and all of the speakers. So please, if you rush into such a problem, I mean the electricity shortage, so it's unfortunately doesn't depend on us. These are the conditions. So Irma represents a cluster of the healthcare, and yes, Irma is very interesting person, and she always defends the Ukrainian healthcare professionals. Now, I would like to invite Dmitro Kush, he's an analyst on healthcare management and organizational coordinator of UNDP in Ukraine. So, thank you very much for providing me the time. So we know about all the conditions the healthcare system in Ukraine has to function. Again, my name is Dmitro Kush. I'm the analyst in healthcare sector. I represent UNDP in Ukraine, and I would like to present you our organization. And if we get the presentation, my slides on the screen, it was really great. Thank you. I'm really lucky to get it. I would like to mention that the UNDP in Ukraine is one of the agencies, the UN agencies, still functioning in Ukraine, and we continue to function in all the spheres of the state. This is the education, social sector, and healthcare as well. I would like to mention that our healthcare activity it started since 2014, since the very first aggression, and so we limited ourselves with Lugansk and Donetsk Oblast. But starting with 2022, the full-scale aggression, we increased our coverage. We covered 10 oblasts of Ukraine, and we have target communities where we provide our activities. I would like to mention that we in DP we have several portfolios functioning on the level of the community and also the central level. And in case we talk about the community level, this is namely Donetsk, Lugansk, Dnipropetrovsk, Sumy, Chernihiv, Mykolaiv, Kherson, Zaporizhia Oblast. We have more or less 10 communities in every oblast, and over there we provide our target activities. So we have our own specific link with the donors with whom we cooperate, and namely one of the specifics is the donor. One of the donors is Denmark government. They work in Mykolaiv Oblast, and they decided to do it for Mykolaiv Oblast, and that's why the action plan is developed specifically for them, and the specific interventions are provided for Mykolaiv Oblast. When we talk about Korea government, so the Korea government says that, okay, we know the rehab needs, so we will work in rehab. Now we have another request, namely in frontline territories. So everyone specifies its own priorities, for example, in Sumy, Kherson, and so accordingly to the needs and requests, we create our interventions. I would like to mention that for ourselves, we specified some specific priorities since one cannot cover everything. So we identified them accordingly to the needs and requests in the healthcare sector. So we put them in line with the healthcare reform. This is the HAP service, palliative aid, urgent aid, and medical education. Let me mention that, namely, the material and technical assistance from our side is provided, namely, to support and empower material and technical basis of the medical services provider, empowering of the staff potential, increasing the mobility of the healthcare services, and we also provide for research. So we also support the TB and HIV programs, then the procurement, and namely rehabilitation wards, procurement and delivery of the rehab and assisting technologies. Namely, for example, when we addressed with the help for some like reconstruction or refurbishment, okay, we also participate in such activity, and Latvian government helps with this. I would like also to mention the results of 2024 and what we plan for 2025, what is ongoing and what is planned for implementation. And also I will cover a part of 2025 as a horizon for our planning. Let me mention that according to our priorities, we build up the potential, namely, I mean, in for those facilities providing the rehab services, namely here we support the educational training. I mean, within the colleges, medical colleges, for example, educational schools, medical vocational schools, to to provide for medical staff empowerment. So we also supply the the equipment for fixed healthcare facilities. Namely, we procure the vehicles in as well. So, and also we do research, study, survey, and trainings. Same, we got the request for laboratory equipment for urine analysis. We will supply them. We already supplied a part of this equipment and will continue to do it in 2025. We also work in digitalization for medical facilities. We also got the requests to the improvement of the lab services. So we provided them with the lab information system, I mean LIMS. And this is one of the spots to get this ISO certification for these labs. So we also try to create the comfort work conditions. We have to care about medical staff. That's why we decided to launch a pilot project, and we created 15 psycho-emotional cabinets for for medical staff relaxation. And so, namely, we did it together with Denmark government, and we digitalized about 80 working places. So digitalization is one of the interests and priorities in Ukraine for UNDP. And together with the donors, we procured the equipment for over 2 millions of US dollars accordingly to answer the requests for namely for the from the medical healthcare medical facilities, and also we support the prosthesis laboratories and also their production. Yet I have 2 minutes. Okay, so one of the main areas of activity is to empower the healthcare professionals, starting from the medical universities graduates and medical colleges graduates. So we here we provide a whole range of different interventions. One of them is to work with NHSU. Namely, we will launch a resilience school for healthcare professionals, and all together with the local staff, we will develop the courses and trainings in this area. So we were one of the developers of the urgent medical technician in Ukraine, the educational program. We continue to support this program, and through this program, we managed to train over 500 of ambulance vehicles drivers, and the drivers who are the full scope members of the first aid teams. And we have the unique program to develop medical staff. We created a school where we trained the multidisciplinary teams on rehab. And also we have the physical therapist of the future. We took the medical staff without any experience, and so we help them to be trained into such rehab services, I mean qualitative rehab services. And we plan also the school for occupational therapists. and also the so-called mono service on the level of community training. Let me mention also that we work with an area of communications. So these are the communicative trainings, palliative aid trainings. And also, I would like to mention that we try to support our partners in rehab and education areas. So we printed by ourselves, and we also help to print such guidebooks with so-called virtual reality for the healthcare professionals. So one of the interventions is to increase the mobility of services, healthcare services within the frontline communities. Namely, we created for multidisciplinary teams, as you see, the specified vehicles like mobile lab, mobile outpatient clinic, also having the so-called uh, first aid teams and vehicles. We would like also to strengthen the telemedicine area, in namely those facilities who already attended this program. So we will develop their experience. So again, I would like to say about the research we do in palliative medicine, so namely intersectorial aid and assistance. And by this time, we finalize this research and we will publish the report with the recommendations for national level and community level. And then we plan also to help the communities to identify their needs in palliative aid services.
Відповідно, будувати
I respect will develop the strategy and parallel resistance in the community level. Our big intervention, which is planned in the public health sector, where we're searching for partner, work on the community level. I would like to thank you for your attention. Sorry for taking a couple of more minutes of your time. Would like to thank UNDP for their big project, which we implement jointly. Round of applause to Dmitro. Now, I would like to invite Sarah Benson, the program manager in healthcare, senator and person international relief.
I should hopefully, getting it in my ear. I should hopefully be a little bit quicker, as I only have like 4 or 5 slides. So thank you very much for allowing me to come and present my organization. Samaritan's Purse is a Christian NGO that was founded in 1970 in the States. We are international. I've worked with Samaritan's Purse since 2017 and been anywhere from Africa to the Middle East. This is my first time responding in Europe, but we do also respond in Europe when the needs base is here. So Samaritan's Purse, when it comes to health response, we do food, we do NFI, we do WASH as well. We have 4 different modalities that we usually use when we're bringing in healthcare. The first modality is our emergency field hospital, our EFH. So we can kind of we often use the military as our template. We can move a whole hospital from the US to any country within about 72 hours. We have a full DART staff. We have surgeons, we have doctors, nurses. We can bring a full surgical theater in a plane and pretty much be anywhere within 72 hours. In 2022, we came in, great, thank you. So in 2022, we came into Ukraine for the first time with our humanitarian response. So this was our first modality. which was bringing in EFHs as well as some outpatient stabilization units. We were also able to organize a small ambulance transport program, working alongside MSF as well, to be able to transport patients as they needed to in and out of the country. So as the situation continued to expand, Samaritan's Purse brought in our second modality, which is training. So we actually started in 2022 to do some medical training program. We bring in our nurses and doctors to develop some basic trainings. We really focused on nurses when it came to our medical training, and teaching on basic IPC, so infection prevention control, trauma, burn, and ICU. In 2022, we were able to train over 6,000 people. And that was, about 6,000 unique beneficiaries, with some people going back to our trainings in about 46 different facilities. So our training team was able to mobilize and go all over the country. You guys have quite a few awesome hospitals that are really open to training and are really receptive. Our third modality of bringing in health supplies is through donations. Samaritan's Purse has its own planes, and so we were able to bring in cargoes and cargoes of medical supplies into Poland and then transport them into Ukraine. Our first year was a huge amount. We were able to do over 250 metric tons of medical supplies into the country. And over 120 medical facilities. We also started to support a huge number of Ukrainian organizations. This was a very different response for us in the sense of seeing how much of a response Ukrainians were able to muster on their own. Samaritan's Purse at this time, I think, supports over 300 different independent organizations in Ukraine as you are helping your own people. And then in 2023, when it came to the emergency field hospital, we kept it here for the DOH if it was needed, but Ukraine was able to be on top of their own emergency response. So we focused on training and continued a bit with the medical supplies. Our training team continued to rotate all over Ukraine, and we were able to teach quite a few nurses mostly. So over 8,000 nurses and doctors were trained in over 100 facilities in 2023. And we continued to do some of the medical supplies as well in 2023. And then this year, we were able to do our fourth modality, which is actually direct medical implementation with local staff. So in 2024, we started to do some mobile medical units. With Samaritan's Purse, it's really important that we work directly with the Ministry of Health. Our clinic is legally licensed to practice medicine, and we work only in Zaporizhia right now. We're hoping to extend to Kharkiv next year. Basically just trying to focus on quality rather than quantity, and being able to fill some of the gaps that the Department of Health are not able to fill. So really looking to work alongside the first aid centers that the government has in the front lines, and being able to do direct medical care with Ukrainian doctors and nurses. We also are directly supporting dental units. So these are dental partners. They're all Ukrainian organizations. We had 3 dental partners that we supported in 2024. And they were able to do over 5,000 consultations. And these are mobile dental units that are going on the Eastern Oblasts. And then our plans for 2025, we're, again, like I said, hopefully going to expand to Kharkiv. We did not have psychology last year, so we're hoping to add psychology and to have a cardiologist and an endocrinologist rotate between our sites. And we'll continue to support our local dental partners. And that is pretty much it for me. If you guys have any questions about Samaritan's Purse, I think I was able to go under my time.
Thank you, Сара. Дякую. Сара була
Sarah was the best person who met my timing requirements, and we have one more person left. I invite Victor Woos, technical advisor on MHAPC. Save the children. Victor, you have 8 minutes. Thank you very much. Tall, and I should reduce my time. There's some logic behind that. So, I think you all have a question. Who will make a presentation? What would be that presentation? So, I, after all, for presentation, you interesting presentation about that much of the work you've heard about. I would like to have a look with you on the future. What unites all the presentation, all the organization? This is children. This is our future generation, the future of Ukraine. Now I would like to present the organization Save the Children. So now it would be me, who is the representative of the organization and an advisor on PSS and Save the Children. I'm the advisor in this organization, and in addition to this, I am a core chair of the technical working group, regional working group on mental also of Kiev hub, which covers Sumy, Kiev, Cherkasy, and Chernigiv regions. You know that the UN and WHO created a program for the coordination of all the government and non-government bodies. There is a health cluster, there is a protection cluster, and there is something which unites them, National Task Force on Mental Health, to improve what the previous speaker mentioned, not the quantity but quality. We mean the establishment of the regional working group. So I'm a representative of the regional working group. Now the point is, can we go back? So, Save the Children is one of the oldest humanitarian organization. We're younger than the Red Cross, though, but in 19 Save the Children was established, and now this organization, more than 100 years of experience of implementation of work with children and their surrounding, and it works in more than 110 countries. In Ukraine, we operate from 2014. We started in the east, now we expanded the activity, and we have the offices which cover Western region, North, South, East, and there's a country office which coordinates all the work. I'm an advisor and MHPSS in the country office, which coordinates all the works of the organization in the country. So though we have children in our name, we don't work only with children. So we develop the society friendly to children. So we work, yes, with children, with family, with teachers, with everyone who surrounds the children, with community, with society. We develop social norms which would make the path for the development of children. And mental health is a key component of the development for Save the Children, not only in Ukraine but throughout the world, and it can be reached that we international evidence based support programs for children and implement them in Ukraine. It's not just cut and paste. No, we make adjustments. You all know about the pyramid of the services, and as you the lowest level is the basic services and safety. Yeah, that in Ukraine fairy tales should create a comfort zone before you ask about stress. So we need to create basic services. We also work the support focus on strengthening the families and community, and they're non-specialized. So those three levels they cover the biggest part of this society. We don't work on the four specialized level. We work on the first three in order to provide non-specialized assistance, develop the competences of people who are not experts, and that secure dissemination of the culture of psychosocial support. We again, we don't work on the force. Psychology, psychiatrics is not our area. We develop the society friendly to children. What kind of programs we implement? There's a substance proof international program, HEART, education, so development programs, team up, resilience for youth program, and work with the society. We introduce the culture, social, emotional program. And there's a program I support my friends. The previous programs have therapeutic effect. The one develops the outcomes for the future. The children would be able, after learning, be able to implement something in their communities. The outcomes. We decided to consider international programs and implement them in Ukraine. Over the 2 years, we were able to understand them, develop the models for Ukraine, develop the potential of the communities, local partners, the development process. The 23, I personally had more than 120 days of training. We trained more than 2,000 facilitators on that specific. When we developed that, when we developed the implementation models, we had monitoring so how it is implemented. We added the independent expertise from the Ministry of Education and Sciences and got a recommendation for our two programs. We had the first in Ukraine, the roundtable on the programs focused on children in Mykolaiv region, and we support government initiative. My dream is to develop the infrastructure and focused on children support programs in Ukraine. That's we work in cluster hospitals, Save the Voice of Children, our initiative, information hubs in cluster hospital to ensure accessibility for mental health services and in Lutsk today they're opening the uh, Cherniga Chinkasa will join us. It's not just words, a specific picture, specific presentation. This is what we do with Coordination Center, the YACA. We provide equipment for the resilience centers, government events, the community. Our outcomes are based scientifically justified. We had a study, and the key point that the 20 we had a study, and there's an interesting component. 90% of the respondents were using humanitarian service, but only 9% of people trust and express satisfaction to international. 90 used and only 9 were satisfied and expressed that. In order to change the numbers, we ran a study worldwide over the past 20 years, which management programs were implemented throughout, and main barriers were identified for the promote and which were the obstacles on this program. And based on this, we developed our approach to manage PSF to develop the potential to the monitoring, how it's implemented, increase the culture mix, social request for those through advocacy campaign. And of course, we need to engage multidisciplinary approach, cross-sectorial activity, and cooperation with the government sector and the professionals, as we plan to go for diversification. We support diversity of the development issue. We introduce not only one or two programs, but the program for children want to move and through the feeling of the body, feel the satisfaction from social interaction. This is a team-up program for those who want to reflect, to dream, to be art person, art programs based on that. The programs focus on cognitive development. We do that.
And that's why we do it. We provide activities in communities, namely children friendly spaces, temporary virtual spaces, and first of all, this is a coordination on the regional level through technical groups. And same to make it better, to improve the quality. I'd like to say we are really proud that in 6 months I managed to develop the collection of the database, namely the database on supervision and the support of the facilitators, and also the database for all our programs. I mean, we implemented digitalization and about the TWGs. So we had them on Kyiv Hub, Chernigiv, Kharkiv, Cherkasy, and Sumy. So please join. And we also form the values in the society. Namely, we have Save the Success collection, where we developed the data showing how the children change for the better, how this change positively impacts their parents, schools, facilitators, and all the environment. So these are the so-called specific cases for facilitators is to know how to do, what to do in the structure. And shortly, let me tell about TWGs, technical working groups. So just this weekend, I returned from the event um, uh, covering the Eastern and Central Europe. So for this, the experience this is quite valuable for Ukraine. I mean, for coordination was presented in. Sorry, I really overusing the time. Sorry. Thank you, Victor. Colleagues, we somehow delayed in time, so that's why we transferred the debates. We will postpone them in evening time for you to be in time for lunch, and also for those who came in there to stay to check in. So please 15 so 2:15 p.m. Please be here, since we will have the MOH representatives to report, and we will talk about fundraising. Fundraising is not just about money, it's about the trust in those people who do this. So, colleagues, you have 1 hour to do your check-in and to get lunch. So please come back here in an hour. So in 2:15 p.m. Please drop into the general chat that we continue working after lunch. We'll get 1 hour panel. It will be very interesting about the context and quite useful for those who work in medical structures. We really want to emphasize that talking about the healthcare sector is not just about the service, but also about the Euro integration of Ukraine. So we have been focused on the person, on the individual, I mean, on the people. So it's about saving people in that time and after war. How to do this? We will discuss it with our guests. First of all, I would like to invite Marina Slobodnichenko, the Deputy Minister of Nature and Euro Integration, Paula Pavlenko, Senior Manager from USAID on the healthcare, Matthew Stevens, Country Director, International Medical Corps, Marko Isailovich, Health Coordinator, International Rescue Committee, and Oksana Balanska, the member of Regional Office of the International Cooperation under the auspices of Mykolaiv Oblast Administration. So I wish our healthcare system to be really sustainable, notwithstanding any crisis and war. I'm very thankful you're here. And it's really great we have the donor representatives and government representatives. It's very important to establish the dialogue, and in particular with the local healthcare facilities. It's about the joint needs, the joint expectations of the outcomes, what we expect each from the other. And so, third questions will be like a blitz question, just needing short response. I mean, assessing of the current healthcare system status, judging, considering the country is already undergoing the third year of war. So, what you want to put the emphasis on, namely? First of all, thank you very much for the invitation. We're pleased that the healthcare system stays in the focus of attention, and it's really great. You mentioned the three parties and like society, government, and international society. I mean, donors. So, what are main challenges we faced up with through this year? Well, I can shape up in several items. First of all, staff. I mean, healthcare staff and staffing. Unfortunately, we have the outflow of the staff from the medical sector. It's not only the Ukrainian typical problem. It's for any country. So next is we have big ruining of the medical healthcare. I mean healthcare sector. I mean so of over 1,700 of healthcare facilities were ruined, totally ruined. So how we can work in these conditions? Yes, then infrastructure that includes central heating, water and sewage. Sure, we are dealing, or we have to deal with the internal migration of patients as well as the also medical staff. So the load is redistributed among the healthcare facilities, but plus So what I mentioned is just the top of the iceberg. So let me express my thoughts about the assessment of the healthcare system. So the Ukrainian healthcare system still stays sustainable, resilient. And this is not only my own idea. It's the judgment. I mean, the assessment, also coming from the international bodies and organizations. So, as you know, the Ukraine joined the international committee. And namely, the international committee assesses the healthcare system of Ukraine is really sustainable and stable. And this is thanks to the all parties involved, national as well as international. And I'll be very happy to join the general discussion. Anyone to provide the assessments of the Ukrainian healthcare through the last 3 years? Maybe to compare with the other countries' experience where you got your representatives or you yourself got the chance to work.
Thank you so much. Let me take this off. Can people hear me? Yeah, good. Thank you. So I'm Matthew Stearns. I'm the country director for International Medical Corps here in Ukraine. I've been here for 2 years. IMC has been here since 1999, fully present since 2014. And so we have a very localized kind of perspective here in terms of the way the healthcare system works in Ukraine. And then, of course, that historical understanding of the robust system that was in place nationally, the way the system responded to the shock of the full-scale invasion, and the degree that that system was made resilient in the first place, even though there were, let's say, investments and commitments in motion to revise, update, and modernize the Ukraine healthcare system nationally. The impact of the war was a sudden shock, and I think that's why a lot of international actors like us were here to be supportive in that moment and continue to be supportive and of assistance in that moment. And I think it's important now in this moment where the conversation in the healthcare space in Ukraine is about this bridging of absorbing the shocks from a humanitarian point of view, this emergency gap-filling, populations in crisis, ability to respond, but then also at the same time, connected and in parallel, this broader commitment to a vision of the Ukraine healthcare system that is strong, robust, heading toward, let's say, goals like EU accession and EU standards. And the system is very, obviously now in a world famous way, Ukraine is very resilient, right? The healthcare system, I think, is an example of this resilience. And there's so much to be proud of. There's a lot of work to be done. It's a complex thing. From my point of view, I've worked in other, let's say, crisis settings around the world. And my perception of the willingness to cooperate and collaborate in good faith from the leadership in Ukraine from a ministerial level. So our line ministry, of course, is the Ministry of Health. And the openness to frank and, let's say, principled cooperation from an international partnering point of view has been the best of my career, I'll say. There's a lot, in other instances, navigating other ministries in other countries, it's been a lot more challenging, say. And here, I think there's a spirit of cooperation that speaks to Ukraine's resilience and ability to absorb this shock in the first place, and understanding what the presence of an international medical corps, for example, what our presence here is meant to serve. So I'm very grateful for the support, particularly of the Ministry of Health, and that vision remains something that is shared, certainly from our side as an international assistance partner. I hope that makes sense. I'm stopping now.
Thank you. And I hope that Ukraine will share lessons learned and other countries will get a chance to use these lessons and these products, because I know that lots of organizations and ministry, we have products, we have ERP systems, we have projects which can be used in international experience in other crises, and Ukraine will be glad to share.
One more point on that because it is so exciting. We're already seeing this happening, right? So Ukraine's sophistication, resilience, and the talent.
In the blackout hours, for us it's critical since we have the ICU wards, ICUs that have to function, notwithstanding the blackouts and notwithstanding all the acute impacts of the war conditions. So, who wants to join the dialogue?
So I'm Dr. Marko Isailovic. I'm the health coordinator for International Rescue Committee, and IRC is one of the oldest NGOs in the world. So we have a huge experience working globally. But we started our response in Ukraine on the offset of the recent conflict, so back in February 2022. And I would say, as a humanitarian, we are trying to look at the problem and figuring out how to solve it. And there were many wrong assumptions made on the beginning, thinking that the system will not be able to respond.
Made by Ukrainian?
No, made by humanitarian organization, I think the global community. And you proved us wrong. You proved us wrong completely. You're extremely resilient. The way you adapt into to respond to like shocks or situation that we couldn't even fathom happen. So we are here to learn from you. And as Matthew said, I will compliment that we are here also learning, trying to compile the best practices of humanitarian organizations working together with the local NGOs, local initiatives, ministries of health, to form the best practices, lessons learned, and maybe implement them in some other future emergencies. And as well, the technology that you are using, I'm really amazed with the level of technology in your healthcare. So thank you.
Дякую. Пані Вола.
Дякую, дуже чекала.
Thank you very much. I have been looking forward to listen to all the colleagues with whom I'm sitting here. Let me add and switch our discussion into not how creative we are, how resilient we are, and so on and so forth, but to speak about the challenges themselves and what we have to do. We already heard from our colleagues all these critical comments and objections. But let's be positive. Why we really managed to stay on and be resilient? So, if not this reform that we implemented in 2018, it's really hard to say where we would have get into this as today. I mean, what condition we would be today, since we changed the we changed the stimuli themselves. Since yes, we got good doctors, but they were few, mainly. I mean, in number, there were. Since yes, the doctors, I mean, were so poorly paid that it's really well, hard to wait from them some care, real care about their patients. But now everything is transparent through the e-health. We have transparent contracting. The primary line knows what they're paid for, but there are negative, some sides, but so-called disadvantages. Here to speak about, first of all, motivation. Some people are, let's say, aspiring to gain as much money as possible, and so they refer the patients here and there, like the balls in the strike. So, but yes, it happens. But again, generally, if not the reform that we really managed to implement, it would really be so hard for us to survive during COVID times and in particular in war times. So, for the future, we have to change the stimuli for the first line, primary healthcare line, So, also, it goes about palliative aid and rehab, and in there we have or to add some more coefficients or to raise the tariffs, and then to optimize the primary line network, since 40% of population stay outside of Ukraine. And if in case, all these 40% get back, so the experience says that, well, rather 10%, not 40%, but 10% would get back to Ukraine. So the primary healthcare line has to be also reformed in a way like to be really specialized, but at least to get optimized in a good way. And I fully agree with my colleague from Ohmedit. And please read the article of Irina Andreitsev that is published recently, where she described all the pluses and minuses of our healthcare system according to World Bank and WHO reports. On the reform of financing of the primary line. So, again, I recommend you to read this article, and in particular, what is negatively, let's say, gets really negative attitude. It's the optimization, but we will need 120 cluster clinics and about 150 highly specialized hospitals, since the cluster hospital provides the services to 300,000 people, and the highly specialized hospital to the 750,000. So, and again, when talking about whether or not there's a sense to let's say to preserve some local small clinics or to change them into palliative clinic and so on.
І поки тут є і представники держави, і міжнародні донори. І я Я не знаю, чи Україна остання країна Європи, в якій ще немає кадавр-лабів. Тут багато представників лікарень. От дуже ми реально розуміємо, що ми в цьому дуже плані відстаємо. І з огляду на те, що разом займається медичними місіями міжнародними, це один з наших найдавніших проєктів, хоча б тимчасове ліцензування іноземних фахівців в Україні, щоб вони легально могли працювати, легально могли надавати послуги, робити операції, аби цим займаються. Це таке прохання, можливо, є якісь напрацювання, будемо вдячні за досвід. І з міністерством би раді, і ми знаємо організації, які з задоволенням би доєдналися до цього процесу полегшення. Мені дуже сподобалось, як Меттю сказав про те, що українці резилієнці класно реагують в кризових умовах. І я думаю, всі ми пам'ятаємо ситуації, коли нема бензини, десь знайдемо там якісь ці машини, які привозять їх, нема світла, зараз поставимо генератори. Дійсно, українці – це ті, хто вміє реагувати швидко, ефективно в кризових ситуаціях. Працюючи з американцями, я зрозуміла, що в них це менш розвинуто, я скажу дипломатично, але в них дуже класно розвинуто оце long-term planning. Планування надовго, прорахунок, як діяти, який ефект буде мати. Тому зараз я би, тут уже буду окремо давати питання вам, Меттю, я би від вас хотіла би почути, які рекомендації, або який план, або яка візія.
What's the vision for the year 25, 27? What the sector should look in supporting the hospitals, where there should be equipment, medicines, or training projects, training of the management for the hospitals, or specialized education for the staff in the hospital. What should be in the focus, what you would highlight in the years 25, 27?
Thank you so much. So what I would focus on here, right, from our point of view, we're concentrating on this, combining these two visions of how does a long-term resilient healthcare system that was already working toward optimization, and let's say a post-Soviet kind of model, right? And those efforts are complex and underway. At the same time, we have this long frontline area where local communities are being impacted in a way that translates into what we call humanitarian needs. Okay, so it's a complex dynamic between the two of them. From my point of view, I mean, I have a bit of a, let's say, I'm careful not to be too biased on this. I mean, I'm a career humanitarian, but at the same time, we can see in this context that we have an opportunity here to do right by, right, what we see on the front line as obvious needs from a humanitarian point of view. And we don't think that that question and that commitment should be abandoned, right? We can't abandon it relative to, I mean, the needs that are there have to be captured, evidenced, and they should be demonstrable, and they are demonstrable. We don't want to let that question go. So, but as part of the longer term vision, the shock absorption, we say, into the system of what's going to look like a longer term vision for Ukraine, we see a way to build resilient mechanisms that include things like power continuity for healthcare facilities, revised mapping in terms of some of the redundancies that we've seen in the Soviet model, where we had, you know, that there's an argument to be made that there are too many healthcare facilities on top of healthcare facilities, and maybe there's a way to make that more efficient and more representative of the local populations that they're meant to serve. I mean, these are a couple of themes here that show how we can bridge this ability to respond immediately and fill gaps that might be there in terms of personnel resourcing. So far, so good for us, for International Medical Corps. Our teams are comprised exclusively of Ukrainian medics, doctors and nurses, and pharmacists. We've found a robust personnel resourcing pool there in terms of the medical professions. That said, we do see space. Part of our core programming is training and capacity building on emerging healthcare needs in surgical domains, trauma domains. And so we've got an international apparatus that can speak to that vision for the healthcare system. Those conversations as the whole thing moves forward together, right? Those conversations as the whole thing moves forward together, right? I hope that's making sense. It's a complex dynamic, but there's enough goodwill and brain power in the rooms here to sort this out. So, and Ukraine is, we're here at the service of the Ukrainian vision, right? International partners should always be deferring to where does Ukraine see itself going? Right now, the signal that we have is Ukraine wants to move toward an efficient, modern healthcare system. How can we be of service in that way? Okay, a lot more language there for you. I'm stopping again. We can talk a lot, Paula, about it. We can talk a lot about it.
But, дякую.
Thank you, Paula. There's a civil sector and the hospitals. And the hospitals are learning how to apply to the grant, how to apply to international law. They are learning. So sector. What? And I hear often from many donors that we followed the request from the civil society, but maybe for the donor during the decision-making process. Here we have the hospital, civil society. We work with broad sector of services. What would be your advice? What is
Першим роком, при тому, що 6 мільйонів українців виїхало з України, і ті, скажімо, послуги, які ми важко зманіпулювати, а тобто пологи і вагітність, теж знизилися. Звідки у нас 30% зростання? Цікаво, да? Так, от ми креативні такі. Так от ми за те, щоб креатив пускати в більш, скажімо, позитивне русло. Ну і на останнє, у нас не дуже багато програм, які ми розпочали зараз, але у нас є. У нас є продовження програми, яка називається «Поглиблення реформи і відновлення сфери охорони здоров'я», яку виграв Deloitte. Це програма, яка розрахована на 5 років. Ми тільки от недавно підписали з ними контракт. Вони зараз в стадії спілкування із нашими колегами з МОЗ, з НСЗУ, для того, щоб вибрати 4 пріоритетні області, але вони будуть теж продовжувати працювати на національному рівні. Є багато можливостей співпрацювати, тому заохочую. І почався у нас проєкт з реабілітації, реабілітація для України, Rehab for You. І зараз триває конкурс на підтримку розбудови системи психічного здоров'я, особливо на рівні громад. Це буде 50-мільйонний проєкт. 15 січня це дедлайн подачі пропозицій, тому що це відкритий конкурс, будь-яка країна, будь-яка організація може на нього подаватися. Дякую.
Дякую. Марко, я до вас питання.
Marco, my question to you. Partnership, we're together, we're joint ideas for the implementation. For us, partnership is not about the improvement of the quality of what you do. Expert, you engage different experts. You don't need to keep everyone expert pool of your own, but this is about training peer-to-peer, finally, without and increasing your own skills and knowledge. How the civil sector, Ukraine civil sector always was there, but never the profession. Volunteership, so one can be paid for being a volunteer, and we're rather young in this work. How to cooperate, what we need to know, how to do that, to cooperate with mammons of the global sector. First, it's important to know where Ukraine would be in the future, whether it would be provide good quality support, assistance to patients, how we can learn from those who have already long established process, and we have something to take from.
Thank you very much for this question. So, IRC has a localization strategy, and especially in Ukraine, we are pushing the limits that we set up globally. And at the moment, our ambition is that 40% of all the funding coming to IRC is implemented through the partners. Specifically, one of our biggest institutional donors, USAID, for the new project, we are putting 50% of the budget going to the local actors. And Ukraine has a big pool of civil society organization that for us is first time in the you know in the world that we see this many civil society organizations who are working with such a high level. And I feel that some of the donors, international donors, or the international community is kind of pushing the localization strategy, which is great. But on the other hand, I feel that the local organizations are also kind of pushed to do more, which I think is it's not a good approach. Some of the partners that we work with, and some of them are in the room, are amazing in their own sector, in their own niche, in their own area. And they should really work on expertising this and teaching other bigger organizations on how to do this quality level of service. What we did with the response to SUMI, we are lucky that we received huge amount of private funds from US to our NGO, and we wanted to use these funds to start up some pilot projects, but also to engage local organizations. So what we do for SUMI response, we engage 3 local partners, we organized a design meeting, and we said, okay, what each of the partners sees as a need, what is the added value of each partner, and then how can they work together to make the highest impact. Ukraine, as many countries in Europe, and I think globally, are struggling with human resources, especially health human resources. And on my first lecture of public health, my professor said the most cheapest form of medicine is prevention. And this is something that I come from Serbia, so we also came from this like communist system and then socialist system, and there were a lot of wars and back and forth and pre-accessory to EU, and we never worked on prevention, we always work on curative care. And I think now you have the opportunity to use the expertise to work and support the Ministry of Health on the curative part, but as well, INGOs are here to support the community health. So working with the community, teaching them on self-care, teaching them on healthier lifestyles, how to access preventative care. Our colleague from UNFPA was talking about the new processes about preventing the cervical carcinoma. So I think this is a great initiative, and I think this is also a future and a lesson learned from Ukraine. Thank you.
Thank you.
Пані Марина, я
Marina, now the question to you about the challenges. We talk a lot about the challenges, about the problem, but I would like to have a dialogue. Sometimes we don't ask what we. So I am a representative of the civil society center. How we can help you? How the international donors can help you? Maybe there are available programs like to join it. Should we bother you? So your expectations from us. Let me expand the focus of attention which the previous panelist spoke. At the beginning, you had a great question. What the international organization, donor organizations are looking when they tried to help Ukraine to assist Ukraine to assist the healthcare sector and the civil society sector in the development of the system.
Тут декілька речей.
There are several issues here. Two important factors as of today: the war and European integration. As we're talking about the future, and when we talk about the war, we should focus on the needs and the priorities of the Ministry of the Healthcare, which they define as key ones, and of course the donor would look on strategy. Probably this is one of the initial documents which international organizations are looking at, the strategy in healthcare, and we expect it to be available in December. I encourage you to uh, look at this document. It's publicly available with some adjustments after the cabinet amendment. So we expect to release very, very soon the strategy by the year 2030. The next document, the tasks which we get from the European Commission on our European accession. These are the priorities in healthcare area, which we definitely have to keep in, because we need to achieve those standards which we get from as a homework, and the donors would look at that. This is as the foundation. Now about the opportunities. The opportunities in this difficult time, which we have a lot, and we're getting more and more opportunities. For example, with during the war, we have huge humanitarian support from international organizations. In addition to this, we have great support from specific countries. It's important to observe the partnership with the countries which Ukraine has. The Ministry of Healthcare announced their support and this partnership on a regular basis. And why I'm focusing on this, because the support from a specific countries, the governments allocate funding for their international organizations, which allocate those financial research to Ukraine, including Ukraine. For example, last week, with the minister, Victor Lasho, we signed a sectoral agreement with Denmark. Sectoral agreement with Denmark with financial support for several years, three for micro residence, psycho health and mental support, and pharmaceutical regulation. This is the money which would be allocated for this support their community, not for the equipment, not for the medicine, but institutional development.
And now, next focus of your attention. What to get money for healthcare facilities, for universities and medical societies, and say, this is a question. In response, so please pay attention to Euro for Health and Horizon Europe. The European countries already used to that they are financed through these two instruments. We don't know how to use these instruments, how to take part in these organizations, but we are getting closer and closer. And the civil society also can join them. And the money from Horizon Europe for education, for research, for development, they are really powerful. And this financing can provide to Ukraine the opportunity for development. And to finalize, so what we can use as the really direct and simple cooperation, it's medical partnership. In a year, or through this year of medical partnership, we concluded agreements, lots of agreements, and so we built up the potential of the healthcare facilities. So this initiative allows to directly cooperate, I mean, for the healthcare facilities with the same facilities abroad. And so the MH, for example, recommends, seeks a partners and recommends to support such initiatives. And lots of international organizations like GIZ, Expertise France, joined this initiative. So WHO also joined this initiative. I mean, this is a developed system allowing for direct cooperation between the two healthcare facilities in different countries, and it's really a very effective initiative. So let me advise you what will we miss, namely, oops. What do we miss again? So these are people who are ready to invest their power, their time in such partnership, since such partnership requires energy, requires big efforts, and if you find a person, such a person who's ready to invest his or her efforts in such a cooperation using Era for Health and all other platforms available. So you should find at least one person within your facility. It will provide you for really big opportunities. Yes, it's among trendsetters as well. Yes, let me put the same emphasis that different phases will provide for different opportunities for cooperation. So, I mean, this assistance that we get for medicaments or equipment, everything will change. So this will decrease in amount, and then mainly it would be like counseling, and then I would like to say that your healthcare facilities should be resilient but also flexible and be open-minded to education and new knowledge. So, Roxana, please present your new knowledge, some interesting cases of cooperation or to work with donors. What has helped you to find a good donor? Thank you. Let me build a bridge from what Paola mentioned to the secondary healthcare line, since over there, what we feel, it's a decreasing of the opportunities in resilience of the secondary line. So we're trying to find the issues, since we got lots of situations when some charity funds, they are eager to enter such facilities, I mean, of secondary line for some interventions, and you have to use it, since, for example, in Mykolaiv, we have a team of 6 persons. We are working quite close with our local government. Namely, it's a management company. We all work within the healthcare sector. So volunteering mainly. So again, what is the opportunity that we get in there? First of all, it's an instrument. The instrument to get the donors who are eager to enter our oblast. So we can, for example, distribute the facilities by the levels of the needs. Since we have to use our resources, really economically reasonable. And let me tell you in 2 words, we have experience with funds in organizations, charity funds and organizations since the very beginning of the war. We have been involved in logistics. Logistics, it's a quick communication in between those who are ready to help our healthcare facilities from one side with the collection of the needs and requests, from the facilities themselves. Then we have to communicate with the local government representative in order to, let's say, identify or saging the needs and requests for the donors to avoid some problematic issues with logistics. So we have a base of medical procurement, which can use the products and equipment which drop out of the logistics. And when we work with any donor, the main and most important is the reporting for the donors to see that the money is used the best way and the beneficiary really received everything. So we make this reporting in line with donors' requests, also using mass media, electronic mass media. In one of the successful cases of working with international donors, and in particular, I'm happy that International Medical Corps are here. So we really got very successful case of collaboration with you, namely the assistance provided to Bashtanka community. And the last year, the biggest amount from your fund was allocated to our mental health care center, which really in big needs of equipment and accommodation. And plus, considering that mental services will be in even bigger needs afterwards, and that's why the cooperation with the donors shows that the whole amount is decreasing or reducing, and that's why we have to provide for its reasonable usage, since only those facilities which get into the network, assistant network, will be supplied. Yes, this is a challenge, but we have to find, say, an opportunity within this challenge. We have donors which continue or who continue to work with us, since for them it's really comfortable to work with us, since we provide for logistics, first of all, and other aspects. And that's why all the local governments should have this instrument in place as such groups which work with donors, which know how to work with donors, who collect the information and can show the areas for the donors, the areas for their activities. So, plus we know how to work with Smithstream and other platforms. So yes, we will continue to collect the needs. Plus, we have this information, and plus we know how to, let's say, direct or redirect the donors' efforts for them to be successful. And this is really a great, successful instrument. Plus, I would like to ask all the donors, when they want to enter any area or oblast, first of all, to do this through military oblast administrations for better management and best usage of such resources. Thank you very much. Now, please, 1 minute for to voice your greetings, let's say, for the 2025, namely for the healthcare sector in our healthcare system. Greetings for the next year and best wishes would be what? Me, I'm from Odessa, for example.
Greetings, 2025, and greetings to a continued resilient, and strong healthcare system in Ukraine. I want to thank the colleagues for the time here. I think one thing that I'm looking forward to seeing here, especially the theme of mental health, I think it's a huge issue here. There's so much receptivity and excitement around this subject in Ukraine, represented by, at the highest levels of leadership, from First Lady Zelenska, her initiative Barrier Free, and actors like us, who I know we are making a good faith effort to really build on that momentum in terms of that baseline access to quality mental health care services, especially for vulnerable folks and veterans and their families. This is a huge, exciting theme. I'm really looking forward to watching this unfold in the Ukraine healthcare space over the next year. So here's to mental health in 2025.
Thank you.
I would wish all of us victory. Victory, first of all, on our conditions, Ukrainian conditions. Next, to all of us, all the assistance programs being financed by USA to be same effective under the new administration, US administration, since we really launched really nice projects which we want to proceed, to continue, and to really, for them to receive the same aid as it was.
Thank you so much. I would just say two things for IRC. we will work the next year on, together with Ministry of Health and our dear partners, to develop better rural health strategies. And I will announce now that the second part of April we will organize a conference related to rural health and mobile medical units. So that will be exciting. And the second thing, to contribute to Matthew's mental health, we did an amazing report with dear organizers, Darovi, and I will invite you all to take and read the report. And I think it's very important. We're talking about lack of resources, human resources, financial resources, resources in equipment, but then the resources we have, we need to take care of them. Half of the surveyed doctors and nurses and felchers and midwives don't feel relaxed at all, since it's been 2 years of COVID and now almost 3 years of war. So we really need to work and provide services to them as well.
Thank you. Ну, я скористаюсь можливістю.
Let me use this opportunity. I yet have to voice the appreciation words for all in MOH as well, for them to continue supporting the resilience of the system. So please continue doing it. But I would like to see the next year as a year of opportunities for the healthcare system of Ukraine, and to serve as an example for other countries of Europe and the world. You have to believe in your own forces. You have to, let's say, to open yourselves in really some other situation. We have so powerful opportunities. We are really the country of opportunities, powerful opportunities. And I would like the 2025 to be the opportunities for others as well. And thank you very much for supporting us. I would like to be a dreamer. And as a dreamer, I would like the time to come when not the hospitals will fight for the doctors, I mean, to get the doctors, but the doctors will fight to work in Ukrainian hospitals. So the hospitals to be able to provide as best as ever services to the Ukrainian people. And yes, we have to rebuild all the hospitals being ruined. And for these hospitals to have the really the state-of-art equipment, even for making a coffee. Natalie, just 1 minute. No. Yet we already overused 10 minutes, so let me tell you big things. And at the very beginning, I told you, so please unite, please create new partnerships. And we provided for lots of time for coffee. Now you have just only 15 minutes for networking and bridging. And next we will have very interesting discussion on how to get the resources, on how to overcome the burnout, and how to deal with the challenges we are facing up with. And also we will get the debates with very interesting and energetic times.
with this panel. Tatiana Tunisia. She is from Разом for Ukraine Charitable Fund. Sergei Gorощак from Odessa. Olena Kandaurova. Ksenia Возныся, Director of Rehabilitation Center Лесова, понятно. Victoria Romanuk, Vice President Afina, and Larissa Zagrai, Professor, Charitable Fund, Razom for Ukraine. Let's start. Hello, dear colleagues, dear participants of our conference. Before we start our panel discussion, I would like to thank everyone, those who bring the victory together, the defenders, the medical workers, the transport chair volunteers, every one of you. I would like to thank you very much. The medicine is one of the important areas in life of every individual, and every day it's facing new and more challenging. The year 2024 is not an exception. So engagement and keeping the staff during the war as an issue, because there's a family behind every worker, lots of other challenges in addition to the war, which we'd like to have a discussion. Olena, you are the person who stay uh, uh, and support from your hospital to the population. So you're limited in staff, there's safety issues. What kind of strategies you have to keep the staff in your polyclinic, whether it works? I think that you are under daily shelling. Hello. So with the hunger, staff hunger, which other hospitals say, oh, we did not experience that back in 22. Of course, at the beginning of the full-scale invasion, our doctors were not able to come to the hospital. About 20% lived in northern Saltoka, north of Kharkiv. Yes, in the first days, we did not have enough doctors, and I'd like to thank the doctors, the nurses, everyone who was walking to the hospital, staying in shift for a week or two, depending on the circumstances. But thanks God, in our city, it did not bomb us as heavily as the city of Kharkiv. So the inhabitants of the city of Kharkiv started to move close to us. The private polyclinics closed the first days of the war. So some doctors came to us as volunteers. We cooperated with them. We decided to keep them. And some of them, just two, two is still with us. Some of them left. So some of them stayed part-time with them. We use them remote, and they come to us from time to time, though it's quite a distance. So our doctors, our nurses left at the beginning of the war, but summer 22, many of them returned. We have some vacancies which community needs. Local authorities responsible to fill in those vacancies. So what did we do? Our doctor was sent for training, and our Kharkiv Academy was happy to enroll them for the horses because they also need a job. So our surgeons were taught how to do X-ray, and they're highly qualified now. And we don't have a problem with that. Qualified, sir. All the nurses returned. No, we don't have the vacancies for the nurses. Some time ago, I thought when I started my career, I was thinking of establishing the team, and the team will support me, will implement different projects. I thought that I didn't have the team, but at the beginning of the war, I realized that I do have a team, and when we did have a team, about 160 people, but that was kind of a skeleton. We tried to. I'd like to make a comment also about the mental support of our staff, if it's okay. The burning out, which we discussed even before the COVID, is totally different, which we experience now, and COVID demonstrated that burning out, uh, being not indifferent to itself, it's been, that the war demonstrated that is burning out. We have lots of, on top of the chronic stress, to maybe have signs of aggression, other features. So at the beginning of war, I saw it with my staff, and we started to cooperate with other organizations to provide mental support to healthcare workers. In June 22, we had some training. Individual classes were not successful, but the group sessions demonstrated that people were ready to open in group sessions with Charité and other clinics at several group classes, and it was obvious. The success was obvious. We want to continue that, and the community needs that mental support. It happened that we're a small city close to Kharkiv. We have lots of pensioners whose relatives are outside of Ukraine, and these people need social support, psychological support, and with their treatment, with it, that we won't be able to succeed with comprehensive treatment for those people. Whether my understanding correct that you motivate your team through group training for self-development and training? Yeah, people should find it interesting to be a part of the team. Yeah. So our salaries are not high, 15,000 for the nurses. This is not the highest salary, but people value to be part of the team. We follow the principle, we develop additional services. We won't be able to have new packages, heart attacks, other packages, but within those services which we provide the package, we try to deepen that, to improve the quality. So people find it interesting to stay with us. Thank you very much. I would like to thank you for being so devoted. Victoria, your NGO does a lot of work to support patients with cancer. Your NGO advocacy campaigns for the legislation, the support of medical cannabis. You created in for center, and reading your CV, information about your NGO, you understand how many professionals are engaged to this process, how you engage and how you keep the professionals in your NGO. First of all, we are probably unique in Amazon. People join the health services being devoted to that, but we are the patient organization. So everyone in our organization is the patient, and everyone in our team is facing the diagnosis, and they're doing what they're doing now. Unfortunately, over the time we lost 8 members of the team. One Uh, third, right. So the war is not the only challenge in Donbass because to fight cancer in Ukraine is difficult. And actually, what everyone is facing problem during the treatment, individual treatment, getting the diagnosis. This is probably motivation as well because everyone did something for herself to get the medicines, get the services, and then we started that it would be available for everyone. Probably this is the best motivation when you succeed in doing something, and when you have the core peers who think the same way, who move the same way. The first day of the war, I got a thought whether we need to do this at all, whether when young people were dying, whether we need to assess patients with cancer, what should come first. And we got lots of requests because it was chaos in the first days of the war. The patient didn't know what to do. We immediately started. I'd like to thank those who supported our organization from the second day of the war. We already had the cooperation with the ministry at different roundtables, thinking how to cooperate. And this is acknowledgement to those who move together with us, who provide their support. We are part of the charitable fund Patients of Ukraine. And this support allows me personally to move. If I wouldn't get the support, I would not be able to move. And from the Patients of Ukraine, this is a very strong organization, from the donors, and gives this is the motivation for the team. This makes us stronger. My colleagues, from my colleagues who works in a hotline, we launched this hotline during the war. We have the support from WHO. Imagine that this is the best work in my life. I feel I can help people. I do what I want. I see the outcomes. It really helps, and I can help many people every day. So we help hundreds of people, hundreds. Difficult not to burn out, but when there's a people next to you, there's doctors, for example, when the warehouse with medicine was blocked first days of the and me negotiate with the ministries and the head of the hospital with the driver go to pick up the medicine. That was the motivation when people are doing things which impact the life of many people. This is the motivation as well. Probably this is my message. You're getting great support and you follow the peer to peer, and that means a lot. Xenia, Victoria mentioned the support peer to peer. It's interesting to hear about the experience of your institution. You're the lead institution in Ukraine and Europe. You're doing a medical rehabilitation of our combatants. And this is the work with trauma. As a psychologist, do understand how it might be difficult, where to get the resource, the motivation. Maybe interesting international experience. Uh, Thank you for the compliment. In our center, to take care of the staff about the team is not simple. This is a professional need. This is part of our professional quality. Work with people who have mental disorder. You have to be absolutely strong and resilient, unlike in any other profession. In our institution, this is an stream how to take care of people, and six highlights. We can talk about those in details later, how to implement it in your institution. establishment of the idea and quality service and philosophy of the institution is the prerequisite of success. During the announcements of the vacancies, of psychologists, we have 5 to 6 applications. They want to work with Lisava Polyana because there's a principle. Our institution, our philosophy is very attractive, and that cost us a lot of efforts for many years. This is the foundation. Next, we are very active in putting that in every project. It even does not refer to this as a usual training project and any improvement. We do include this component. Work with the team, supervision. And thanks to this, our team has a minimum 2 sessions per month supervision session, which are more people who work with this know how expensive it is, but we should do that. Our know-how, we call it a retreat, but we managed to do it second time. Last week, we took our team, 50 people, and our psychologists. Sort of a soapy club where people were able to relax, get spa service, and that was a great. So there is people still discuss under the impression. And next week, our 30 nurses would go there. We were not able to take everyone at the same time. We got assistance from German doctors. It's expensive exercise. There was a dialogue whether we should have spent 500,000 greeners for something else or on the team. So we decided to spend on the team. And the third, we provide lots of free training, which is expensive for the professional. Up to fourth, we the center of excellence. You prepare yourself. You will become a trainer to a street. The first important component were the audit for psychological comfort at the institution. We did it for the first time in 21, and in January we expect expert in January who will spend a week with us. So I advise you to use this. This is available for match for you can do that. Ukrainian Swiss project, and our unique team, our clinical case managers. We have 7 professionals who are basically assistant to the patient, assistant to the multidisciplinary team. They sometimes can find solution for daily household issues which may irritate the doctor and distract for daily activity. This is our block of activities, and we have my deputy in psychology tracks like this. Sometimes we can let a person go for 5 days just to relax, so sleep, stay with the family. Let's go for a round of applauses. That's a great doctor. Thank for from our psychologists for your supervision, supervisory support, opening the doors for us, sharing your experience, understanding how busy you are. Sergey, when I was getting ready for the panel discussion, I read some articles, some publication about you, and I think that challenge as an opportunity is about Your polyclinic number 6 is a successful case. One can find in it. What do you do that your staff would not go to the private sector? What kind of methods, mental support, motivation you use for your team? Best regards from our polyclinics. So threatening, but we have a guest guy with us. Of course, this is a joke, but when we saw that back in 22, the beginning down from 300 people, 60 left, about basically the nurses who evacuated their kids, we realized that the specialities very specific, which is not possible to replace. So the joke about to buy, we decided with administrative team that to every employee who stayed gave 1,000 greeners per day. Everyone, regardless whether it's healthcare worker. So when they got the salary, they like it very much, those sorts of things. And the word of mouth spread that for several months, only 5 people did not return. But so when they saw the implementation of programs, well, we should be in a hurry to come back. So this works. We also saw that this is psychological burden which started during COVID time and with Alona. I agree with Alona that at that time mental health there was no like a promo mental support. If a person realized that something goes wrong, and you realize that, oh, panic attack, well, doesn't matter. So this stigma did not allow the people to apply for professional assistance. I know that might be different for us, whether this program, how you works, it works because the stigma is still there. One of the polyclinic will focus on the child, on the family, and different services, early intervention. This is one psychologist, polycures, and rehabilitation, one more psychologists. We see that this is a kind of a unique areas, but who is doing what? They don't know.
В одному закладі люди, психологи не розуміють то, чим займаються. Це треба якось об'єднувати для того, щоб, ну, по-перше, всі знають, особливо хто дотичний, без супервізії, ну, така собі психологія, ну, не працює. А потім, коли ми побачили, що є запит ще і у співробітників, починається з такого: а як от ви вважаєте, у мене подруга от щось почала там, і починається. Ти розумієш, що це не про подругу, ні про друга йдеться. Це йдеться про якось встидання звернутися до колеги. Після того, як ми зрозуміли, що вони не хочуть звертатися до наших, ми почали проводити саме навчання для команд своїх колег. Більше, ну, по-перше, наші готуються, і вони вже з інформаційного простору, телеграм-каналів виходять, і така гігієна, і навички. Але саме головне, ми зрозуміли, наскільки багато є партнерів, які всі послуги, і також ніхто один одного не знає. Коли ми зробили ці маршрути, ми чітко розуміли, куди могли б все ж таки порадити звернутися на перший час до своїх колег, бо раніше ми цього не знали. Коли ми провели буквально от там пару місяців тому конференцію, назвали її «Психологічна качка», ми зрозуміли, що кількість операторів, які дуже фахові, дуже круті в одній кімнаті, вони не знають один одного взагалі просто. І коли ти розумієш, а як так може бути, бо ми чомусь оці маршрути між собою не вистраюємо. Тому я дякую, що саме от майданчик сьогодні це якраз для того, щоб ми знали один одного. Зараз ми розуміємо операторів, ми зараз розуміємо, де ми не фахові, і ми можемо направити. І саме головне, вже у наших співробітників з'явилася довіра до наших психологів. І у нас така буде, кому якщо цікаво, тут такі маленькі зарисовки, це колегам я передам, а кому може буде цікаво, подивіться. Смисл такий, що коли вийшов проєкт по створення центрів ментального
When the Center of Mental Health already started developing, we've seen that there are clusters and clusters and so on. So we, I think that it's rather financial issue. And after realize that within this coordinate system, we don't have any payment we have to do by ourselves in order to assist to help our families, our colleagues. That's why everyone has to do what he or she is possible to. And plus, this is a dream that is really highly paid. Thank you very much for your innovation, for your involvement, and for your humor. Larissa, you're not a professor, not only a professor, you're a great practitioner, and you embrace the highest position, providing the psychological help. And from the points of practical point of view, what are the motivation methods of helping the medical professionals, and why we need this so-called organizational psychology? Yes, it's true that we can do now an inductive deductive approach, saying that all the speakers were telling about how to provide for the dual level of psychological atmosphere in order to retain the staff, give up the staff within your facility. The main philosophy in the speakers mentioned, this is the philosophy of values and of support of the healthcare professional. And so here, it doesn't really matter of the area of work, I mean medical areas, since yet in third year of this of the Harton experiments on electronic factory. Well, it was proven that the true psychological support provides for the best achievements. In particular, when people asked, how do you feel? How about everybody at home and so on? And share the values. When our work is valued highly, and our efforts are duly appreciated, and from the other side, the support and good psychological climate are valuable things. But again, the burnout happens quickly, in particular in our conditions in the third year of war, and we have to work on the individual approach in order to preserve the mental health of everyone. So everyone in his own working place has the opportunity of to serve himself or herself as a psychologist, asking yourself, what are these emotions that they feel now? What is all about? For example, we draw a circle with my clients and so on. I mean, first of all, trying to understand your own emotion which you live through. I mean, like how to separate your emotion from yourself in the sense, okay, I have an emotion of fear. Yes, I am me, myself, as I am, and this is my emotion. And I'm trying to assess what is that emotion. So it means actualize your emotion, to realize what happens to me. And even that simple technique uh, provides for us not to bury this emotion in yourself, but get rid of it. And that's why very important attention is placed on that. And when I started to work as a psychologist, people started asking me, what is this really? What does it mean? And I'm really happy that mental health has been put in the focus of attention. And so, first of all, try to work on asking yourself every time what happens to you. And also, psychologists advise to keep up a good, positive emotion all the time with you for your own support. And so you got here you have the angels to keep up good memories and like serve as guardians for you yourself from all the evil. And thank you very much. Thank you to my big thanks to all the participants. So and now the time for questions. So please.
Доброго дня. Я навіть не питання, я хотів.
Good afternoon. I just want to provide a comment from myself and from those women who got disease for cancer and received really big support from the organization Women Against Cancer. So I really highly appreciate that thanks to you, we feel now that we are really cared by someone. We are being supported, and those who managed to survive, they survived thanks to you also. Thank you very much. Thank you. Also, I want to say big thanks to our partners who support us. There's the director of Nova Ukraine here, and let me express my thanks to you to provide us with the opportunity to give medicaments to all our patients. Unfortunately, people in Kherson, they're scared to go to the distribution points since drones are hunting them in the streets, I mean Russian drones. And now we started to send them small parcels, medicaments with a bar of chocolate. And they they say that they really found in tears after receiving such a parcel, feeling that really someone cares about them, and also about the consultations being provided to the doctors. Unfortunately, doctors don't apply for help. We got just one request of one doctor, but please apply, since we also have to think about our mental health as doctors. It's a very hard topic. Now, colleagues, also, please, 1 minute for the final word. I would like to say that notwithstanding all the events, all the hardship, we really managed to survive and to grow higher and better. Everyone has to do his or her work on his or her own place, and I'm thankful to everyone who makes their inputs for our medicine to grow better and higher. And this is our Maidan. I mean, this is our place to help each other to grow better and better as the country, as a society. And let me say that those who stayed, who decided to stay here in Ukraine, to work here in Ukraine, please make something with your life, not only to survive, but live it full, drink prosecco, meet your friends more frequently, get some pleasant emotions, positive emotions, to really to see each other, to help each other, to laugh, to enjoy this life. Thank you. We will withstand. I think we do, every of us does what he has to do. Say, and that's why I wish you all the best and first of all, good health. The main, we have to go out from this bulk we're sitting inside, since what we can do, only we know about it, and that's why you have to speak out about it. So, and to know how to speak out. So once a wise man said that don't be shy, since no one cares about you, and plus to that you are shy. So go out of your bulb, speak out, get your wings and fly up. Thank you very much for your sincerity, for your openness. We fit into 36 minutes, and now I would like to do some exercise. So, Larissa, the floor is yours. Think over about this exercise, and we move to the second panel. Thank you, thank you. Please applause. We have our own timing, and we have our colleagues who are waiting for the second panel. And I would like to invite Oleg Tokarczuk, the coordinator of Edelweiss Brigade, Medical Brigade, Right to Protection, Ольга Беспалько, from Ukrzaliznica, Olena Yefimenko, Director General of National Institute of Cancer, and Natalia Chorna, Supervisor of the project, Razum with you, or together with you, or together for Ukraine. Welcome, welcome all the panelists. I'm very thankful for you to come here to join us Yes, and now talking about the involvement of all the experts, we have to speak about, first of all, about the prophylaxis of the burnout. And now, please, let's shift the focus, not, and also talk about the donors and the funds. So, Oleg, you're the one from Colombia. You took decision to help those who stay in the front line. What are the methods of prophylaxis of the burnout you use for yourself, and what do you recommend to your own team? Thank you. Welcome, everyone. It's really hard to say, or to name some specific methods. I don't have any specific approach for preventing my own burnout or any single instruments, but once I've been to our educational project event, and I heard to listen to a lecture of Andriy Zagrabelny, and I got the response of what an adult person needs to be or to feel in comfort. You have to go to bed feeling yourself a successful person. And okay, let's say when, in particular, when I am not at home, since we live in the basement, this because of the chilling since already for 2 months, our stabilizing point is being shelled by the Russians. I managed to evacuate everyone of my relatives and friends, but I'm staying in there. And the question of burning out, namely for the armed forces, is it's really maximum important. And in particular, when someone starts to, I mean, from the civilians, starts saying, "Oh, I'm burned out," I start really, let's say, so really upset since I've got lots of experiences seeing what happens in the front line and those who have to withstand under the shelling. And I think that the best heroes, those who are the doctors and stay on the front line, since they're risking to die 24/7, and those who are staying in the hospitals, working in the hospitals, I mean the doctors working in the hospitals, yes, they also fight, but they fight with their forceps, scalpels, and so on. They don't have to dig trenches. We're not heroes, we save heroes. But also, these doctors also, I mean, the doctors also suffer from the burnout. Why? Because they are forgotten by everyone.
No need to give them, no need to compete for them. They are in the army and they don't have the opportunity to lead, none. There is small niche because of the family reason. Someone is looking for the second option to be demoralized, to be critically wounded. No other formal way to leave the army does not exist. Among my colleagues, I see that the real burning out, they observe what's happening and they climb from where they came. There's no place to come back. No vacancies. The younger colleagues doing certain things are better experts than them because they're in their own niche, professional niche. So those doctors who are not in the medical forces and in the general army, and a lot of them, no one is engaging them for any training program. And this is a huge problem. If someone here thinks that is that remote training through internet is sufficient, no, they cannot go anywhere. They exist only in their battalions as stabilization points, the transfer points. They exist in their own bubble. They may see something is happening in the big land, but here and there is no place to return, even if they keep the job free. But after 2 years in service, you have nobody is waiting for you back home, and this is the point of burning. It's very difficult for me to convince them that everything will be okay with just words which work for the first half of the year. So indeed, this is a question to the civic sector to support those people, to convince that they're needy. And this is a question again to our political environment. Basically, we generate and we ask them for that part, they need to know when they can go back to civic life, when the exit point. Probably asking the question not for this form, but this is for your understanding. Uh, this is basically my message. Thank you very much. Thank you from all of us for your choice. I would like to continue your statement. Probably some disagreement because for me personally, every individual who decided to use either scalpel or the gun is a hero. So for me, you are a hero, and thank you very much for that. Let's give a round of applause to Alec. Nadia, your fund implements a lot of international projects. We understand that it requires engagement of experts. Were there the packages of mental support for the work for the project, and what is in your toolkit for the motivation and prevention of professional burnout? Thank you very much for the invitation. Interesting to be with new participants. Our fund will work with humanitarian response. We provide legal, psychological assistance, social services. We work with material support for the individuals and with social protection. There is collective center for ADPs. We provide cash assistance. We work with economic inclusion programs to try to assist development of entrepreneurship for the vulnerable layers of the population. And we help with unemployment issues. Our targeted audience are IDPs and vulnerable population. Over lunch, we had a chat that the most vulnerable from the most vulnerable people with disability, lonely parents, families with many children, people who lost everything. And this is whom we work with for these 3 years. The people who got from our specialist assistance reaching up to 3 million recipients. And our team today, 1,200 specialists. We work in 22 regions. This is difficult. Why? We work with this from 2014. Work in the east. We had offices in Mariupol, Slavyansk, Bakhmut, Severodonetsk, Kharkiv, Dnipro. We had some experience, but the scale of was not the same. When the full-scale invasion started, and started of millions, we had to respond quickly. Everyone was there. We grew from organization 170 people, 1,600 people, and it happened over several months. I think initially it was sort of easy for us because everyone all the time tried to do something, tried to assist, and they worked on protection and got the support from the donors. We had some reputation where there were support programs there, and I think we were one of the lead organizations in this sector, big advocacy campaign. And last week, at the meeting with executive partners of one of the biggest donors, Ukraine, we tell our partners that they should develop duty of care for their staff. What do we do basically? Simple things, but the key point, we have the values which are not words, humanity, human-centered approach. This is people whom we help, our recipients and those who help. So all the decisions are based on this. People are important. Without them, there's no organization. None of the international support would be needed without people. We try to create inside the organization safety environment based on trust and how a mistake for us, for our colleagues. This is about experience, but not about fatality, which can impact and work a lot on that management should share this and should deliver to the linear managers. That should go like waves. Inside the organization, we have the program of the support from psychologists, a psychological service. We have 100 psychotherapies. They create certain light around themselves, and that creates the wave that the mental health is important. There are a lot of bias, but simple that it helped the beneficiary. Let me try as well. We had an opportunity sometime to provide visual support for the management of the organization. We support the transparency of our procedure. Someone cannot stand that. There might be concerns on the misuse, but probably our compliance procedures are good, and there's a local mediator. It was not easy to develop trust. Yeah, people work in the regions and compliance functions in the office, where there is formal or but case by case, people see that this is transparent, this is independent, that this works, and it's important to respond. There is a decision which people implemented, people develop the trust. I think a big role in the organization. We had quick business process, lots of new programs. Now we work a lot that this process becomes strong. For people, it's important to come with understanding how it works. when there's a confusion where to go, whom I should report. We spoke about this support. We have self-support groups, a psychological service. They try to support colleagues. This is internal supervision by psychological service. The supervision is mandatory. Same for the social workers. One of the peers, safe environment. The second pair, physical safety. So it works in the region, in the front line, close to the contact line. 15% very close to the front line. We try to ensure physical safety. People go through special training on physical safety, individual safety kits, vests, casquettes are mandatory. Safety briefing, insurance of life. It took us some time that medical insurance should be introduced before the big team. And next year we start doing it. When people see that you care them, they feel that I am a part of it and they want to continue to work here. And the third pillar, give a horizon. That this month I work for the program. What's next? Strategic planning and the vision of the organization, vision for the future plan. It should not be the level of the head office or top manager team. It should be on the level that everyone in the organization understands this is our horizon and that impacts on the resilience of people and their willingness to be a part of the team. But the last point, I realized that I'm taking too much time. We have our training and development program for the staff. Kind of relax through training. Some people feel that way. We have our corporate training program for people with the team through regional training. We have a development program, access to individual training when someone wants to go for training, individual training. For people, the value that I sincerely hope that that experience might be useful for those who are here. I would like to thank for the opportunity to share this experience. Thank you, Nadir. I think you'll get lots of questions later. Definitely. But if someone would like to know more, dear participants, 100 psychotherapists for organization is a dream. I was looking at Olga when you said, Olga, you have 190,000 employees. Say you are the advisor to the management on veterans. 12,000 of the funding, 700 died of those. But at the same time, Ukrzaliznytsia continues logistics and the healthcare sector, the defense sector. What are the management strategy which you use in your team to motivate a big number of staff? And what's in your toolkit for burning out? Thank you very much for this question. It's nice that we go for a deep dive. I was thinking here how to reflect quickly and help the colleagues who can take something from my presentation in time of emergency require special approaches. It's yeah, with 1,200 people in the service. So it's not the issue what kind of veterans are coming back, but what kind of company they come back to. what is the common for them. And this is the case about the cancer. It's not about the treatment, but the prevention for the disease is important. Just imagine, one can ignore that sooner or later, either you're a civic sector or there might be an issue, sense of your activity globally and what would unite your team. In our case, uh, on, on the veterans who get the disability, we communicated a lot to our boys, girls, and it's important for them. It's important to have a job with the sons. Going back to Scylla, we realize that they are part of the decision-making process. So we launched two streams related to safety. There's a protection center for the cargo, and our ex-combatants can utilize their skills, use their skills. Yeah, 2 years, sort of lost, but the new skills might be useful for our company for the opportunity, but not disability or other problems. Secondly, and the safety block, which motivates the people to. The railroad is a big infrastructure, and they have the same employer, but the problems are different. Where this bus route Ukraine 190,000, and we looked into different group with this by type. Family of those employees who died, those who are waiting for the competence, those who are in gray zone, rescue their life every day. So we looked into the challenges and decided to so some psychologists, and the quality of their work was horrible. I can admit that. That was our mistake, and we admitted it openly. We taught them how to provide psychological support because we are under shelling, and we might be in some cases sooner on site other than the emergency service. So the psychologists who are inside, and then the second line of, if the psychologist said that someone needs more serious support in one of the hospital, we have a neurological department where they can get assistance in the network of our hospitals. And one more point, this is the financial support, so that many insurance companies they basically rejected to provide insurance for our staff. So we had to find solution because we're not able to increase the salary, but to take care of the health was important. Throughout Ukraine, we decided to launch fundraising, sort of the insurance fund, but it's different since it's an NGO, they don't get a profit. So all the funds, like membership fees, go to cover the treatment, medical treatment for our staff. So if the hospital, we have a contract with the hospital for a specific part, but whatever goes in parallel or additionally, or there are complications, you're welcome.
So our employees control this organization. Say now I'm through with this. Thank you, Olga. Thank you for unique experience. And I think that you can also launch the webinars for other organizations, management. Olena, you are having really very specific Institute, I mean National Institute of Cancer, and you were heading the facility in the occupation. You got really a big managerial experience. So, considering your experience, what are the self-aid methods, I mean, to support the mental health? Um, so, what are these programs to help our medical professionals? You know, I listened to Ksenia and I thought, so Ksenia expressed everything I wanted to say. So, yet we have to implement a team building since we have a really big team, 1,200 of employees, and yet we have to find the financing for that. Well, you know, my grandma got his own orchard in garden, and my grandma collected all these, I mean, parcel deal and all this dried fruits and herbs since she was a chief cook in the hospital. And when I asked her, why are you doing this? She said, but this is for our patients, for them to really to have good appetite, to have good food. And when I worked together with Olga in Ukrzaliznytsia, I mean Ukrainian railroads, railways, hospital. Yes, we stayed in occupation. It was really hard when we were called from all the sides and hearing we miss hormones, we miss insulin, we need that, we need this. And so, what we got to do to help, first of all, the doctors, local ones who stayed and continue working, and also to provide some psychological support. And yes, we got to use just boats or any single transport and any single mean of to bring those precious medicaments. And again, when we missed Oksana since she was captured, and we couldn't find her for 2 weeks, and we stayed in under occupation with the enemies. And but yet we have had to continue working. So every time I try to feel, to how, I mean, I try to imagine how it feels to stay in this or that place. So in this is really positive emotions. So when I try to keep up really good memories, which help me to sustain. And yes, we now meet on the conferences. We got grants now, we're getting grants. Like we got 5 million for refurbishment, but it just got it was just enough to refurbish the pediatrician ward. And now when I'm coming to this ward, all the people, including nurses, they say, you see how nice it's now here. And so 45 of our doctors got grant to go get the training in Paris, and I say, girls, you will stay in Paris. Yes, you will be trained from 8 to 6, from 8 a.m. to 6 p.m., but from 6 p.m. to 8 p.m., the Paris is all yours. And also, this is really good motivation for the persons to go abroad for training. And again, I say, don't write me some really, I mean, the local requests. Just write, I mean, send to me the request for grants and like for microscope, for that or that, and I will seek money for this. Yes, we call this so-called small grants, but this is again, this is the motivation, and even the young specialists, they try to show themselves in a way to be in line with our academicians, with our chief doctors, and plus the youngsters, they have really additional resource, and I try to give them a chance to show themselves from their best side. So I try to provide every single opportunity for our doctors to attend a conference, but at the very single condition. So when you come, you bring some information, some experience that we can implement in there, I mean, in our institute. So when you say to buy a robot or the patient-oriented service, so anything we can implement in our institute. And now I see the light in their eyes. And for example, when we implemented the QR codes posted on the walls, it's also a positive moment. Yes, sometimes the negative also happens, but really the good really comes over the evil. For example, we got a chief cook from a very good restaurant to our institute, and now this lady works for us. Her husband and her son are in the army, and when she's praised for her efforts, she's answering, how can I do worse since my husband and son are serving in the army and someone cooks for them, so I have to do it the best I can. So she's doing some nice bakery for our children patients, and when you have the patient narrating clinic and you're interested in helping the nurses in assistance, you will really do it. And yes, so your instrument is to provide the opportunity for self-development, for experience sharing, and thank you very much. I would like to proceed with the opportunities and to address Natalia. Natalia, you're a PhD in psychological sciences, and you're trained the future psychologist. So you are doing academician researches together. So please tell us which experience, I mean, from which country who got the war experience, say we can adopt. Yes, war stress is leading us to the constant stress tension, and this leads into the burnout and exhausting. And the psychologists from different organizations, they always try to employ their psychological specialists to improve their skills. So for us to adopt the foreign expertise, it's also very important since we visit seminars, conferences, and with the beginning of the full-scale invasion, we needed the experience from our foreign colleagues as to the instruments, how to work with in war times. I mean, namely Israel, Croatia, Georgia, and this experience is quite valuable. But as of today, we already implemented all of this. The rehab centers that we already have, and they exist on the high level and are the best in Europe. And the integration of psychological support into the healthcare system for veterans, for their families. We are also doing it, and different techniques being recommended by our foreign colleagues, namely breathing exercises that we also use, different body practices like yoga, physical exercises with subsequent psychological revision, and also to transform the trauma into experience, for the traumatic experience, these events to be transformed, and also cultural legacy with our folk songs, and we can implement our own experience, also religious support groups, namely the comprehensive system peer-to-peer, when a person can talk to another person about his or her negative experience and get the response. And as of today, we all are implementing this since it is a flexible schedule, and also creating new workplaces for the person who suffered during a war, losing limbs, having heavy trauma, serious trauma, and it's very important. In summarizing, I would like to say that only the circularly integrated, comprehensive approach, starting from national level, psychosocial support, and individual approach, everything gives us a really good result. And I think we will proceed with this way. We proceed this way, adopting the experience from our foreign partners. For example, the experience from Israel, they developed their resilience on really high level, But yet we can borrow some specific aspects in order to reach the success. And I'm really, I do believe that we will reach it. Thank you, Natalie, for your work, for your daily work and the supervision, for our experts. That is really the big support. Now, I would like to hear the audience who's ready to answer. Thank you very much for your work. My name is Roman Holdov. I am the head of EVAC group for the wounded soldiers. What are the instruments that you use for remote testing? In case you cannot send your team for some training, since they cannot move any other place. Well, let me share my own experience. First of all, this is the clinical interview dialogue, 5 diagnostics, hospice PSL5 and PHQ9 that we always apply. We have so-called telemedicine. Not every doctor agree to it. And some of them say, my telemedicine in my smartphone. Our doctors consult each other on the telemedicine level. Then we can be consulted by Charité in other overseas clinics. We consult the doctors not only from onco centers, but plus we have call center, our own call center. We can call the call center. I mean, any doctor can call our call center, asking for consultation, for example, some specific surgeon, and we can help. So we with UNDP, we moved through 5 oblasts. We provided the consultation. Like our team from National Cancer Institute with mammologists, ultrasonic specialists, and so on. We came to the frontline oblasts to give lectures to explain them how to build the patient route, how to consult patients, and so we increased the number of consultations, I mean direct consultations. So, in case you have any need from the oncological point of view, please address.
There are some methodologies. So we have some per request. This is what we're doing per request. Should be counseling by psychologists, and then psychologist defines per the request from the company and use for the diagnostic what we have adjusted for. Today, active development digital system in our centers, psychological support. We introduce a digital programs where the client may go through the initial screening using our platform. I'm not sure that I can respond properly because not a special medical establishment. I'll try. The only experience which might be useful because usually it's a serious injuries, and we notice from the feedback that not everyone is ready to cooperate with the psychologist. We provide the training for that category remotely. How to do that screening remote, not screening per se, but the key issues. If someone needs assistance, how in a delicate manner to apply, and we have different entry points where one can come from. But this is a very local case, not directly related to your question, but still. All right. Thank you. This is exactly what the gentleman needs. This is not medical evacuation, but not the doctors, but the drivers. They need to understand what kind of temperature is there, because people work 24, but they're not doctors, but how to measure their psychological status. How to understand whether everything is on track or not. Have different options study there on those areas. We know how to make the referrals. And we recommend in these difficult times to study for initial psychological support and use the self-regulation method. Thank you very much, dear colleagues, for being engaged. Thanks for being so open with us. Remember that staying together, we are strong. Dear colleagues, really, really strict on timing. So we should reserve some time for the other to make presentations. These are your gifts, don't forget them. I promise that we'll start on time. I would like to invite the DBs, our colleagues, Evgen Chief Director General from Lugansk, and Stepan Krulko, Chief Doctor, Tomatherapy. Stepan, I expect you to be here. And it's only 3 questions. And this is a debate format. It's not for us to see the opponent opinion, but the broader format of interaction and probably the search for a solution. The question, the changes, the management of healthcare institutions you think are most relevant during the war? I'll be brief about our institution. I was in criminal Lugansk region a month before the war. I became the manager, the leader. So, but after the beginning of the occupation, everyone left, including myself. And as the manager, I was facing what to do. There were no methodological guidelines. There was not what the national healthcare continued to provide funding to the hospital. I realized that everyone would be able to find a job or would come back. And for me, that was the main challenge. So I thought of the tactic to find a location where we can be able to provide assistance. Initially, we started in Rivne Oblast Center, but then made a deal with the management from Rivne healthcare authorities. We left to Sarny, a small city, but we got some space. And over those 2.5 years, we restored our activity.
В Кремені десь 120.
at about 120 people, but among them 40% are IDPs, not only from my hospital, but from Kherson region, from Zaporizhia region. And we did a lot, but the team did a lot, the support for our administration, and people believed in us, believed in me, and local authorities gave an opportunity to start our operation, and not only in the Ruinary region. They know about doctors from Lugansk, and this is what will take back home. Maybe some Rina doctors. So we had lots of challenges. Financial motivation, one of the most important. At the beginning of 22, we were able to make procurement of everything without tender procedure. We left without anything. So we were only 8 doctors in Rina. Charity organizations help them. The mayor's office from Krakow provided us. Of course, the Ministry of Health should got lots of assistance, but being united, being friends, and our belief that we would be able, that was based on nothing from scratch to create an institution which works and which everyone is proud of. I think this is what makes us proud. We'll talk about funding later. Question to Stepan. This public-private institution. What was the most relevant? What do you consider efficient from the management perspective? Thank you, Natalia. Natalia mentioned that there'll be a battle. So should I box it? So not to have debates, but not a battle. In general, we are a private entity, but we work with some medical guarantees with National Healthcare Service that we're probably a kind of a hybrid of public-private partnership. Though in Ukraine it does not work well. We have about 14 packages, and we're the biggest entity in Ukraine, which gets from private institutions, from medical guarantees. Speaking about the priorities, I think about health, about health care, but very little, unfortunate, about the quality of healthcare services. The main priority is good quality service. So when we think of this as a priority, we realize that if the manager realize that you should provide good quality service, all other good financial, economic, efficiency are secondary, which you reflect in your strategy. So the priority of any healthcare institution a priori good quality healthcare service. After that, if you can do that, next, the word of mouth works. People come to you. If you, this is the best marketing, which you don't pay. Great. Next, what's important introduced under the pressure of force majeure, but it works good now from the perspective of efficiency. I think it was vice versa. To keep the funding from the national, yes, sir, but for the year 23, there was an offer to keep country potential. According to the estimates, the hospitals were able to get more funding than be contracted on all the batches. There was in our case 60% more annually, but the position was our position to keep to be contracted on general terms. The year 23 was not an easy one, but for the year 24, we got funding 3 times more compared to the year 23. Those hospitals who got the package to keep the country, they are not working any longer. Probably there was some personal decision of the managers who found it easy not to do anything but get more and stop working. They physically cannot work. They don't have the stuff, no motivation, nothing. But we work. I think that might be a case. Stepan, if we speak about the challenges, of course they were there, but unlike the public sector, private sector is more pragmatic. Works well with calculation and estimates. The changes which happened, it pushed us to more deep analysis of the expenditures. First of all, good statement about the team. The team should be organized by the beginning of the full-scale invasion. From none of the doctors left our hospital. The nurses did not leave, and we continue to provide services. The development of the team, we were doing headhunting. We were looking for the best. When you establish a good team, and I think Sergey will understand me, this is your team is something which covers you, which helps you to move. And when we started to move in the format of the reality, when you don't know how to work tomorrow, the day after tomorrow, what kind of salary you would pay, where you will get funding, what you start with, you start looking for an extra topic. So we're doing the analysis, but okay, we a for paper. Oh well, stationery, everything good. But when we started to go for a deep dive expenditures, we saw that this is a copy plus a copy, very expensive, and we decided to move to digital here. So without any running the files, we decided to go into digital communication discussion. Next step, the audit of our expenditures. The medicines system is structured in the way that we can provide our financial statements depending on the treatment, like a code. There's a diagnosis, there's a doctor, the patient, so we can do the reporting the different formats. So the different doctors put different diagnoses, different treatments. So we looked into every. We're looking for the position of the medicines without any evidence of proof. So we're not experts in neurological. So we invited this third party to for advisory services. So working for the medical guarantees, we decided to delete the medicines which were not efficient. Again, this was savings from the budget. Article by article, turning off the lights. When there is no people on the floor, the lights go down. Topic to topic, your expenditures, and if you have any savings, you can allocate them for the development of the company, development of the team, and do something for your staff. We also wanted to go for some recreation, but we have a lot of people, and we try to create a comfort zone with our psychologists. We do focus groups for our staff. Who goes where, and we are lucky that we don't have the personnel turnover and efficiency. When we speak about any service, which might be different, we'll look at the capacity of a doctor, a nurse, and we do the calculation how much staff we need. We don't increase the staff. So everyone is working efficient without too much pressure, and they get well paid. KPIs, private sector, their colleagues, our conference is called Partnership Future. What's your vision of the future for the next year, for 2025, for your institute? Our development, of course, and assessing what we did in a small city of Sarny, where people from all Ukraine come to us, except Transcarpathian region. People from Kharkiv come to us, from Odessa. Healthcare services should be of a good quality. I fully agree with Mecca. We have two streams where we would like to do some expand. We're looking for the premises in other region, and we're looking to poly and rehabilitation. Thank you, Paula. Rehabilitation. We're doing that of patients who, but considering there's a demand for that. And we're a small team, and every day we meet, and not only rehabilitation, but the surgeons detail about the so there are two streams we're considering expansion. Year 25, of course, there's a theory that developing the budget for the year 25, and our scheme we have a board of directors, three of us, and everyone is responsible for every center, but we're reaching consensus. We, and me personally, want when we develop the budget, see what will happen in the program of medical guarantees for the year 25. So we want to guess would be in there waiting for the resolution. Let's try to see whether we would be able to guess, and that would help us with a magic expectation. And last question, we need to wrap up. We're waiting for Fusha. What are the scenarios of the crisis prevention? You would give us an advice to your face looking backwards. What's important to hear for our colleagues for them to understand they should be ready for? What would be that about?
Lots of wise things were told already by my colleagues in. I totally agree with all of them. Yes, psychologist support and so on. Just a small example. When a patient comes and says, you have so nice surgeon, he did really so nice operation to me. So that's why the psychologist help is very important. And I would like to say that you have to provide your own experience. When you, as a manager at the head of the facility, you show the example how you dialogize calmly with the patient, with every colleague, trying to resolve all the issues. Same I think that you're copied by your employees. Stepan, first of all, not to lose opportunities. It happens that we are living through the war, and we have a chance for a change. But in order to change, you need to take really hard decisions. The decisions, this is our responsibility, and or you take this responsibility on your shoulders, or someone will take it, someone else will take it. So don't lose your chance, don't lose your chance to change. For the people who died for this, really died for some valuable things. So please make changes. Thank you very much for your ideas. Thank you, colleagues. And let me finalize our event of today. Tomorrow we have the second day, 6:30 p.m. We wait all of you to join our gala dinner. Please join us to get good memories. And now I would like to finish with really big thanks to all of you, civil sector, all the healthcare professionals. Thank you for your time. Thank you, those who joined us online. We got over 100 persons who joined us to listen to our words. I would like to thank our nice partners, Razom for Ukraine. So please, dear colleagues who are here, please stand up. Dmitro, Tatiana, who else is here? Please, colleagues, make a round of applause to those who organized all of this. Lilia, Olena, Vitaly, Evelina, big thanks to you. You're really great. Thank you for your support. And my big thanks to Здоровий team, Irina, Tatiana, Vitaly, Ivan, Katerina, Polina. Please stand up, Olena, Valeria, and all of those who are not here, but who also make all the efforts for this event to come true. Big thanks to our technical team, and please express your thanks to our beautiful translators, interpreters, who also worked for you. Dear colleagues, now I would like to invite you to your gala dinner. In case you have any issues with the hotel check-in, we have Katerina and Lydia who can help you. And I really prepared pathetic words, but now I would like